Ladies and gentlemen, we are now live in our broadcast, and thank you all for joining for this meeting of the Adult Care and Health Cabinet Panel. It is the first time that we have met, I think, since early September. I am delighted that we're meeting despite it being under relatively difficult circumstances, and also, of course, the extraordinary news that as of Thursday that we'll be going into lockdown again. But before we continue the meeting, we have a formal announcement in the usual way, which is due to the coronavirus pandemic, the Council will be holding this meeting electronically in accordance with the relevant regulations. Members of the public may also attend this meeting in an electronic capacity, and there is a link on the Council's website for them to do so. Members of this meeting are asked to keep their microphones and cameras switched off until called to speak, and to switch their microphones and cameras off once they're finished speaking. To indicate a wish to speak, members should request to do so using the members' chat function. I'll be keeping an eye on that. At the end of the debate, on each item of business, there will be a vote. Members should vote using the meeting chat function by indicating for, against, or abstain. And I will declare the result after each vote. Officers are in attendance, and my thanks to Elaine Manzi and Deborah Jeffrey, who will be keeping an eye on us and supporting us throughout this meeting. But we'll keep their cameras and microphones switched off unless called to speak. Breaks incorporated into the meeting as appropriate, and I think we're probably looking at about a 10-minute break at about 11:30, 15-minute break at 1 o'clock. And because this is a very, very long meeting, I suspect we might need another break later on, perhaps 2:15, 2:30. We'll see how we go. Thank you all very much. Disclosure of interests. If you have a pecuniary interest, please, if you could declare it, I'd be very grateful. Yeah, I'll just read the second part. It's too complex. If they consider they have a declarable interest in any matter to be considered at the meeting, they must declare the existence and nature of that interest. If a member has a declarable interest, they should consider whether they should participate in consider of a matter and vote on it. And members will do that. Can we just check? Are there any interests needing to be declared? No, that looks fine. So that's lovely. Thank you so much. Now, I'd like all of the members of the panel to introduce themselves. I'm going to start. It's in a random order, but Nigel Bell, if you could introduce yourself.
Good morning, I'm Councillor Nigel Bell. I'm the Labour member for West Watford.
Thanks, Nigel. And you're spokesman for the Labour group, aren't you?
No, my colleague Drida is spokesman. I'm spokesman for Children's Services. So.
There we are. OK, there we are. Thank you for clarifying that. That's lovely. Sue Featherstone. I think Sue is currently struggling to get into the meeting, but we're joining us shortly. Drida Gordon.
Thank you, Chair. I'm Drida Gordon, Labour councillor for London Colney, and also the spokesperson on Adult Care Services.
Yes. Thank you. Corinne Harstrict, I think, is also struggling to get into the meeting, and we shall get to her shortly, I am sure. Dave Hewitt.
Thank you, Chairman. I'm the Conservative member for Cheshunt Central in Broxbourne, where I've had the honour of representing that constituency the last 15 years.
Lovely, thank you. Fiona Hill.
Thank you, Chairman. I'm Fiona Hill, Conservative member for Royston East and Ermine and Deputy Exec member for Adult Care and Health.
That's lovely. And Vice Chairman of this panel. Tina Howard.
Good morning, Chair. I'm Tina.
I think we'll come back to Tina in a moment. Something went wrong there, didn't it? Jonathan Kay.
Yes, good morning, everyone. I'm Jonathan Kay, Conservative Councillor for Ware South.
Thanks, Jonathan. Good to see you wearing a tie. Nigel Quinton.
Morning, everybody. Not wearing a tie, sorry, Richard. I'm Lib Dem representative for Hanside and Pear Tree in the centre of Welwyn Garden City and spokes on public health.
Thank you, Nigel. I'm Richard Roberts. I represent the Kings Langley ward. I'm the executive member in Cabinet for adult social care and its relationship with health, and I chair this panel. Thank you. And Andrew Stevenson. I think he's struggling on visuals, but we can hear from you. Andrew? We can hear from you. Andrew?
Yes, the visuals aren't coming through the county council system. Andrew Stevenson, Conservative member for Hertford All Saints.
Thanks, Andrew. And your voice is coming through loud and clear, so that's great. Thank you. Ron Tyndall.
Thank you, Richard. Ron Tyndall, Liberal Democrat member for Hemel Hempstead St Paul's and Liberal Democrat spokesperson for adult care and health.
And currently living in deepest Bavaria, which is a good place for you to be, Ron. And William Whitelow.
Better than the mess in my office.
Okay. Thank you, Ron. William Whitelow.
William Whitelow, yeah. Hemel Hempstead Town representative for the Conservatives.
Thank you, William. That's great. Thanks for joining us this morning. So that is your panel this morning. I think I mentioned earlier, but Sue Featherstone is substituting for Fiona Guest, and I appreciate her doing that. Fiona had very good reasons for not being here this morning. She's a practicing pharmacist, and I think her schedule required her to be elsewhere this morning. Apologies, other than, as I've just said, there are none. I'm just going to check any further apologies. No, that's fine, of course. If we move into the minutes of the meeting held on the 9th of September, if I could just, first of all, does anybody query the accuracy of the minutes? I'm now going to switch to chat just to make sure. So officers saying no problems with accuracy, that's fine. I think actually in the interest of completeness, let's agree the minutes then, please.
Richard, if I may draw your attention, Nigel wanted to ask a quick question.
Yeah, that'll be under matters arising. That's fine. And just as purely the accuracy of the minutes. That's fine. Thank you, panel. The minutes are agreed, and at some point I will get to County Hall and I will sign them. Nigel, did you, in terms of matters arising, I don't intend to just dwell long on the minutes because I think much of the content is still with us through today's agenda. But Nigel, please, your point.
Yeah, no, it was just quickly on 3.8. There was a member suggestion that a piece of work could be undertaken regards contacting those affected during COVID to see what additional support. I assume that probably has been followed up, but I just wanted to draw Chris's attention to it, as I'm sure he's on the call, and particularly as we've got scrutiny review at the end of this week. If there is something on that could be provided before the end of the week, that would be much appreciated.
There we are. Thank you, Nigel. We'll take that as read. That's good. Yep. Do you want a quick comment from Chris or not?
Probably not needed.
No, that's fine. Lovely. Thank you. We'll move on. We've had no public petitions presented before us. And one change to the agenda is that I've asked for the Sustainable Hertfordshire Strategy, the action plan, to be relocated within the agenda. So we'll pick that up later. So we're going to and I'm grateful for Hugh Walsh and Simon Aries, who are the officers, agreeing to do that. Thank you very much. Our first item then is Adult Care Services Annual Complaints Report, and Cam Bangle is here to present the annual complaints and compliments. And of course, we have the ruling here from the Ombudsman as well, which is given in great detail. So Cam, are you there to give us just a very brief overview, I think?
Yes, thank you, Chair. Good morning, everybody. So this morning I'm presenting the annual complaints report for adult social care. It covers the period April 2019 to March 2020. What I'll do is I'll go through the summary, and if anybody has any questions, I'm happy to take them at the end. So the summary is, in total, the number of compliments ACS received was 289. That's a 7% increase from the previous year, which is, it's really good because we do encourage staff to tell us when they've done some really good pieces of work, and it's really good to highlight that alongside the complaints that we receive. In terms of representations, we received 351 representations asking to make a complaint or dissatisfied with the service received. Similar to last year, which is, interesting. In terms of formal complaints from those representations, we had 311 compared to 307 last year. So more complaints are being dealt with formally, and only 10% were dealt with through outside of the complaints procedure, which is informal, which is it's quick and easy if something is very low level, and it avoids people having to go through a very lengthy complaints process. In terms of acknowledgements, 89% were acknowledged within 3 working days. There is a drop in that from last year where we were at 94%. So we are looking at what's going on and working with staff to try and bring that back up. In terms of response timescales, that again has dropped from last year. It was 97% last year and it's 81%. Again, more work being done with staff to look at how we can bring that back up to a good level of 97%. But the good thing is responding to complaints within 10 working days has gone up. So 49% of complaints were dealt with within 10 working days, which is a good figure. Because if you think about some of the complexities we get in adult social care complaints, dealing with them within 10 working days is quite hard. So staff are encouraged to try and deal with complaints as quickly as possible. Going on to findings, 20% of complaints were upheld, 19% partially upheld, and 51% not upheld at all out of the complaints that went through the formal process. Senior management reviews have dropped from 8 last year to only 5 in this year's report, which is a drop of 37%. Local government ombudsman cases have dropped as well. We had 27 cases go to the ombudsman last year, and it's dropped to 22 this year. So, overall, the summary is great to see an increase in compliments and the good work of officers and teams. Responding to 49% of cases within 10 days is a great achievement. But overall, response timescales have seen a drop and need to be improved. Upheld complaints continue to remain low. Local government cases have decreased slightly, highlighting the good work that staff are doing in terms of satisfying the complainants through the complaints process.
Lovely, Cam. That's okay? That's really good. Thank you. Yeah. Just before I bring in panel members, everybody's aware this is a huge agenda. So unless you have got a really important point or really important question, feel free to focus on the areas that are really important to you today, or you think are really important to our wider care and health community. I only say that because it is going to be a long meeting. Nigel, please ask your question.
Thank you, Richard, and thank you, Gamoji. It's a very, very helpful report. I just want to focus on the LGO finding, and Ron and I have already spoken to Chris about this, but I think it's worth bringing up in public forum. I read through the report again and the appendix 2. And I'm still slightly confused exactly where we stand as a council on this report, or the findings. 2.3 isn't clear to me whether or not we accept the findings of the local government ombudsman. I'm a little bit confused about the numbers in terms of what actually happened to this person's support. And also whether or not it kind of reads like we were non-compliant with the Care Act until 2018 when Connected Lives came in, but we were actually paying this person more up until that point. So I just wondered if you could clarify, A, what is our view on the validity of the conclusions? B, have we met the recommendations yet? And C, are we confident that the person in question is now getting the care that she needs or the support that she needs in all the various forms that it is provided, appreciating it's a very complicated case.
So I'm going to bring Chris in if you want to bring yourself up, Chris. But just to say that we absolutely accept the findings of the Ombudsman, and we have acted on it and we will learn from it. Chris, if you'd like to add any further detail, grateful.
Yeah, we ultimately accept the recommendations of the Ombudsman about this specific case. I think where we maybe would have queried it was the level of the comment about it being systematic across the council, but ultimately one case is too many, so we accept it and we look at how we can develop our practice as a result. So the remedies laid out by the Ombudsman, and Cam will confirm if I've got anything wrong, have all been put in place, and this individual's won't go into too much detail about the individual case for reasons of confidentiality, but is in place. Crucially, when we, as ever with any complaint, whether it goes to the Ombudsman or not, as well as getting the immediate redress to the individual if that's appropriate, the other thing to do is then, okay, what's the wider learning within the department? Tanya Moore, Principal Social Worker, through the Practice Governance Board, ahead of this being published, would already set up some work to make sure we were very clear, crucially, that we were looking, when someone's got an outcome that we need to meet for them, that we look at what's needed to meet that outcome, and that any sort of instances where there may have been local rules around and not having cleaning as a blanket approach was removed. That was never formal policy. And again, the Connected Lives approach, in a sense, is absolutely part of the remedy to this, which is but working backwards from the outcomes that we're trying to support people achieving, and a much more flexible approach about how that is achieved. And that really removes the need for black and white rules and more on actually understanding through our professionals, social work professionals, community care officers, what's needed to meet those outcomes. I'm confident that a range of actions have been taken to ensure that that is understood across the department. And in that sense, having a complaint raised and dealt with can only help us develop our practice.
So particularly the inference that, and it's within the report, that direct payments are used across a broad range of potential service improvements for that person. That was made clear in the report as well. Chris, just before you come back, how many of these kind of issues across our care clients do you think we have? This is kind of linked to Nigel's question.
Well, we'd only found 2, it's my understanding.
Out of
thousands, a lot. We're talking 10,000 at least.
So it's not systemic then.
No, I don't feel it is. What we must do is be clear that we've got a systematic approach to ensuring that none of it creeps back, and therefore the real focus on outcomes as part of connected leadership, because we also need to make sure that it doesn't happen again. So we're looking at a very wide response as a result.
That's lovely. Thanks.
If I could just come back very briefly, Richard, and that
Sure.
is on the key paragraph for me in the report was under conclusions, paragraph 33, where it says it appears the council's practice is not to meet such needs, but tell people they should fund this themselves, and finds the council at fault for that. Has that now changed?
So we don't believe that was ever a systematic practice, albeit in this case it was. So given that in this case we hadn't funded in the way we should have done, no matter whether we thought it was systematic or not, we've put in measures to reinforce our view that we shouldn't have such a approach. So yes, a lot of work has gone in train to ensure that our policy, which is that we base it on an individual circumstance based on the outcomes, is reaffirmed and understood by all.
Okay, thanks very much.
That's lovely. Ron.
Thank you, Richard. I'm particularly concerned that we are not having any identification of systemic failures, and I think individual errors will always creep in, especially with the scale of what we do, and so they're understandable to a certain extent, although obviously not necessarily acceptable. I'm particularly concerned if one looks at the figures on page 124. I'm concerned at the 156% increase in adult disability services complaints and 181% in the finance complaints. Again, I just wonder though whether or not I know there is a paragraph 5.2 further on which refers to process rather than mistakes, but I just would like to perhaps clarify that perhaps the scale of those increases was concerned with external factors or changes in systems rather than
got the question there, Ron. Yeah, that's great.
And then the other one,
okay, go.
And then when that's done, I'd like to come back to the question of the ombudsman issue, but not in a more general sense.
Okay,
So
well, let's pick as a general point. Thank you, Ron. As a general point, we welcome complaints about the service as much as we do compliments. It basically keeps us on our toes and informs us where we need to improve practice. So that would be a general point. Cam, do you want to pick up what's your intelligence around why we had increases, particularly with our learning disability service and also with finance?
Just mute myself. In terms of finance, I did challenge them in terms of why we're getting so many complaints. There was a lot of backlog of financial complaints which were logged during that period. So, and we're getting a lot of complaints from our service users asking us to review their packages again. So that was one of the reasons why in finance complaints were going up.
And the disability?
And the adult disability is again a very, very complex area, and similarly we are getting a lot of concerns from people with disabilities. Again, having looked at the actual individual complaints, there's nothing there of to worry about. It's more about more people are coming forward to make representation.
I wonder, perhaps, Richard, I realise, off the spur of the moment response may be difficult. I'd be happy if somebody could come back to us.
But there's also,
why 156% increase in 1 year? That's what I'm concerned about.
There's also been a lot of training provided, so more cases are being logged rather than being informally dealt with. So more formal cases are coming forward. Okay, but yes, we can go back and have a further look if you like. Yeah.
If that could come to the next meeting.
Point's made, Ron. Point is right. Can I bring in Chris, please? From a service perspective. Thank you.
Yeah, I mean, I think what I'd say is twofold, and we can follow up with more information. we are talking about relatively low numbers to begin with, so the percentage increase will look quite significant. So we're talking a rise from 22 to 62 in the context of the sort of tens of thousands of cases that we're dealing with. I would rather know more about complaints than less. So in some ways, there's a level of complaints that would also be too low. So I don't think we'd be looking at the issues closely enough. Clearly, finance is one which is a particularly complex area because of the nature of the means test and so forth for social care, and can obviously be particularly contentious for individuals. We're more than happy to dig down and get a note on it. I have been clear that we have looked to increase our robustness of complaints management in adult disability service, and I think in the short term that will have led to more complaints being raised. But I, for one, welcome that because it's a sense of being able to understand what some of the underlying issues are. Thanks.
Thank you.
Just before Ron, you come back on the Ombudsman. This feels a little bit like the safeguarding increases that we saw when we put some more resource and certainly staffing resource into safeguarding, the specialist safeguarding team, and we saw the number of issues raised, which is a good thing because it means we're really getting to understand what's going on across our care community. Ron, if you specifically on the Ombudsman.
Yeah, on 120, page 126, paragraph 7, outcomes. I make that 35% upheld or partially upheld. Now, I realise again, 22 is a low number compared to the thousands that we actually look after. But I wondered whether or not there is any particular strand that indicates a problem within the service, such as commonality of the complaint, overwork of the staff, understaffing, or lack of finance. You know, that is the sort of areas I'm concerned with, not the individual cases, more do they show a trend in one or two areas where we could be concerned?
Okay, well, we've heard the answer specifically on the Ombudsman case and the generality across that it being non-systemic, but we have checked and found that to be the case. I'm just going to bring in Helen Maneuf, if I may, who may have something further to add. Helen?
Thank you, Chairman. Yes, just on finance, I suppose it might be just helpful to make the panel aware of a bit of background here. So probably about 5 years or so, the finance teams that used to sit in adult care services as part of an organisational change were moved into resources department. And I think probably when we reflect back on that, we feel that actually it may not have been as helpful as a restructure as all that, because what it did was separate really the close linkages that those teams had with operational teams. And in dealing with financial complaints, it's really important that you get both the financial aspects, but also the service relationship aspects with the individual to come together. And so back in February, at the start of this current year, we brought those teams back into adult care services. Unfortunately, that was just on the eve of lockdown, really, that change happened. But we do have a big programme of work to do with those teams to rebuild those good connections, make sure we've got very robust business processes. As part of that change, then, we did realise that there was a backlog of complaints in finance that we needed to work through. So that's been top of our priority to get those cleared.
Thanks very much. Cheers.
Thank you, Helen. Thank you, Ron. That's great. Panel, if I could ask you to note the complaints report and the compliments which were up this year in the usual way in the chat function. Thank you. It just gives me a chance to thank Cam for presenting her report and Chris for adding his thoughts as well. Thank you, Cam. Appreciate it. That report is noted, and I'm grateful for you. Thank you very much.
Thank you.
We're now going to move on to the County Council's response to COVID, which has previously gone to the resources and performance panel, but is now going to all panels. So there are only some aspects of this that pertain to our area. But if I could ask Alex to present his report and to focus on the adult social care responses. Thank you.
Thank you, Chairman, and good morning, panel. As you say, the report in front of you is the next edition of the monthly COVID update report to Cabinet. In fact, if I may just clarify slightly, in recent months, this report has gone to the report Resources and Performance Cabinet panel before going on to Cabinet. But because there is no Resources and Performance Cabinet panel this month, it was felt appropriate to bring it to a panel, and it was felt that adult care and health was the appropriate panel to do so.
Thanks, Alex.
And I suppose what I would say is, because I'm going to keep it brief, if I may, before handing over to some colleagues who provide a bit more detail. The report seeks to provide an overview of the activity the council has undertaken in response to the pandemic. It provides a overall summary commentary, but it also includes a monthly impact monitor that seeks to track the pandemic impact on key services, and also a section on the financial impact of COVID as well. As ever, in these very changing environments, these reports certainly represent a moment in time and certainly run the risk of being overtaken by events. So whilst this report was accurate when it was written, hopefully as of the 16th of October, clearly a lot has happened since then. Not least, we've seen a continued rise in cases locally, and obviously in the last couple of days, new national restrictions being announced. As such, I wasn't intending to speak anything particularly in terms of the report, but rather hand over to Martin Aust as the Head of Intelligence for some brief headlines from the Impacts Monitor, and then also hand over to Stephen Pillsworth to cover the financial aspects of the report. So if I may hand over to Martin.
Thank you, Alex. Hopefully you can hear me, everyone. Good morning, Richard.
Hi, Martin. You've appeared before us. You look fine. Thank you.
Well, that's good.
We can hear you.
Yeah, I keep this extremely brief in line with the steer. As Alex says, this is covering quite a wide area, and things have moved on in a number of areas. So all I do is just perhaps highlight one or two metrics that are worth indicating where some of those numbers have actually moved to. Perhaps before doing so, just the key point, which could be lost on us, but I think is worth stating, that both this report and performance data, both at service and corporate level, continue to show and evidence service stresses in respect of impacts from COVID, but no material service failure. Probably a point worth emphasising. So some of those things that have moved forward, and I'll reference the sections as well if that's helpful. So obviously the important one, the immediate one, is in terms of COVID. Both the cases, as reported here, it was accurate at about 2nd of October at 6,538, but now it's, as you'll be aware, moving forward, increasing quite substantially. The last week there are 1,500 additional cases, so we're now standing at over 10,000 in Hertfordshire. In terms of deaths, section 1.2, they too have moved up slightly, but obviously every death is terrible. In terms of COVID cases per 100,000, which is a metric that's widely looked at in both by the press, ourselves, and by central government in terms of triggering. At the time of report, we were saying 74.8 per 100,000 in terms of cases. The latest, and this is as at Friday, the 30th, we were talking about 117.5. But since that point, of course, events have overtaken us in terms of tier levels. So it's probably worth mentioning that 9 of the 10 at this point districts in Hertfordshire exceed what is deemed to be the 100 per 100,000 trigger. And that is relevant depending on how both our response goes in Hertfordshire and how the national response goes to at the end of lockdown, whether we revert back to tiers and therefore what tiers we revert back to. 2 or 3 other areas perhaps highlight. 2.4, care homes with service users showing COVID symptoms or diagnosed with COVID symptoms. When reported about 3 or 4 weeks ago, it was about 15% older service users. The figure from your colleagues is now about 9%, which is perhaps interesting in itself. It has in fact fallen even at a time when cases are going up within the community. 2 others on the children care side. Number of children subject to child protection plan has barely moved, and that's probably good. and particularly encouraging, perhaps, number of children looked after has only gone up by 1 from 978 after several months now of it increasing quite substantially. So the fact that that has hopefully plateaued is there's some green shoots there. School attendance, a difficult one to benchmark nationally. Our figures by any measure bear up well nationally. We were reporting 91.5% average attendance in the primary sector, nearly 90% in the secondary sector. And those figures have remained at that sort of level. If anything, they've slightly improved in the secondary sector, although again, information at national level suggests that that's going to go slightly in the other direction, so we'll be keeping a close look at that. In terms of schools closed, up until the last week or so, we haven't had any schools actually closed. We do now have 1. And the number of bubbles, difficult concept, I won't go into it too much here, was about 45 bubbles in schools any 1 week. This is a huge average, of course. Now moved up to about 50, so 50 bubbles across our school sector are being closed down. Hertfordshire Waste Recycling Centre, perhaps just to pick up the news from last week, we have been recording 14, of course, the Ware one, the new super centre opened last week, if you pick that up in the press, so we now have 15. And the last couple of perhaps highlight, just in terms of business miles, we've been recording about a 1 quarter level of business miles users, as you would expect, that actually dropped further back. So having been 62% down on the same time last year in September, is now 70% down compared to the same month, October this year compared to last year. And finally, peak and overall travel volumes, whether you experience this yourselves or not, there has been about a 7 to 8% over a period of time drop in the overall volume of traffic compared to the benchmark period of early February, just before lockdown. That's gone down a little bit further to about 9.2%. So I'll leave it there, and with your agreement, hand over to Stephen.
Okay, thank you, Martin. It's good to know that the corporate intelligence does reside somewhere, and we now know it resides with you. I feel more confident and comfortable with that. Thank you.
Thank you, Chair. Good morning, everyone. I'm Stephen Pilsworth, Assistant Director of Finance here at the Council. I'll give you a very quick overview of the 2 financial sections of the report. The first one, section 7, towards the bottom of page 158 in your pack, that starts, focuses on the current financial year. You'll see a table there that indicates our current spend forecast for COVID interventions is around £73 million. Indeed, if you take into account all other funding streams, such as Infection Control Fund, contributions from partners, actually our forecast spend to maintain services to support our communities this year is going to be in the region of £110 million. And indeed, as Martin has mentioned, that's a snapshot in time. It could well rise further because of the continued interventions we will need to make. We have received some significant grant funding, but even at that level, the report indicates we have a gap of just over £10 million between the costs and the level of funding that would necessitate a draw on our contingency and reserves. Although we have most recently received our 4th tranche of grant funding, which was confirmed after the report came out. So we have got a further £7 million from government, which obviously closes that gap. Perhaps unsurprisingly, given it is the Council's biggest area of spend, the biggest area of spend in terms of our COVID support is within adult social care, principally around making sure our providers have the support they need to be able to continue care. And indeed, I'm aware, I think the next item on your agenda is a paper that proposes extending that to the end of the financial year. I'd say Chris, Jackie and the management team have done a great job with that proposition, looking at what funding options we have to cover the cost of that. So actually that proposition does not worsen this overall financial position, and as such I fully support that paper. Section 8 of the report then just moves on to the medium-term financial position, looking ahead to next year and beyond. Pre-COVID, next year's budget position was actually looking pretty good. Clearly, COVID changes that. Some of these additional costs will continue into next year, but also we're very concerned about the impact on our income streams, such as council tax and business rates. We're forecasting, even with some further government support, we'll actually have a budget gap next year, and departments are now working hard to see how we might close that. Autumn's when we typically do the IP work, and all those proposals will come forward through the usual panel and scrutiny process in due course. So that's pretty much everything I wanted to say, and happy to take any questions there are on that section of the report. Thank you, Chair.
There we are. Thank you, Stephen. Thank you to Alex, Martin and Stephen. I hadn't realised that the panel was going to be hijacked ever so slightly by this COVID update, but I welcome it nonetheless. Just a reflection from me, having read the report and just where we are. The pandemic, as far as adult social care is concerned, has never gone away. Our staff and our care community right across our learning disability, physical disability, our younger adults that we look after, and our older care community. Our staff have been working their socks off now since February, March, both in preparation for where we are and on a day-to-day basis. And I just think that we shouldn't forget that. As Stephen hinted at, we have another paper coming up about our ongoing support for our care providers, which is a significant investment. And just to say that we are hugely grateful for government recognising the need to support care providers and the care sector, which it has done. It has stood up to the mark. Picking up the point about domestic abuse rising, I welcome the government's extra 6 million to prepare us for new government legislation coming in. I think that will be really helpful as well. And also just picking up as well, the Money Advice Unit, its referrals has gone up and is hugely important, working with the CAB in terms of making sure that all the benefits out there are available to our residents when they need it. And finally, from me, the visitor guidance. We worked both internally and with the Alzheimer's Society to put an ethical dimension into our guidance in terms of visiting, because we want visiting to be continue for as long as possible, although this will be challenged by the lockdown. Without further ado, Ron, could I invite you to comment and ask your question? Thank you.
Thank you, Richard. I'll concentrate on adult care services. On page 157, on paragraph 7.3.6, it refers to non-essential visitors in care homes and the outdated guidance. It doesn't make any mention of close relatives and end-of-life situations. I probably, along with a lot of other councillors, have had to deal with relatives and close and partners coming to me and saying, I haven't been able to visit my husband, wife, partner when and they died alone. Now that was in the early days when we were still struggling to get to grips with it. But I do believe now that we do need to mention in any COVID guidance that is going out there that there is a structure, there is a way forward, and we do need to recognise that situation exists, and we need to mention it in the guidance.
Yeah, thank you, Ron. You're absolutely right. I will bring Chris in a moment. You're absolutely right. In the early part of the pandemic, care homes were very worried about any visitors at all and any external influence that might bring COVID into care homes, and visiting was difficult. In more recent months, and certainly up until the calling of the lockdown, those towards the end of life, it is essential that they meet with relatives, and that is in the guidance that we have out there. But Chris, would you like to come in, please?
Yeah, well, echo that point, Richard, about the end of life, in a sense, ability to, as an exception, to allow those visits. Just to be clear on the position as we currently stand today, We are awaiting some national guidance on the care home visiting, given the position around extra restrictions from Thursday. As soon as we have that, we will digest that and communicate clearly with councillors and care homes and residents and so forth on what our interpretation of that guidance will be and how that will change the guidance as it currently exists. Clearly a huge balance here between infection control and the well-being of residents and their loved ones. But we'll know more later during the week, and we'll update councillors as soon as we know.
Thank you, Chris. But as this document is generic across the council and it's going to all cabinet panels, could someone address the wording in paragraph 7.3.6 to reflect the change and to ensure that this point is covered, because those that aren't regularly in contact with the Adult Care Services, other councillors, may not appreciate the way in which the situation is changing and may be misguided if that wording is left as it is. Please.
Sorry, Ron, this paper is coming to this panel, as was said earlier by Alex. This paper is coming to this panel only. The guidance has gone to all care homes and includes a section in there about encouraging visitors to be with loved ones, particularly in end of life. Yeah. And just, gosh, Ron's disappeared.
No,
and that has already gone out. Further guidance in light of the lockdown announced for Thursday will be forthcoming, and certainly isn't going to be reliant on 7.3.6.
Lovely.
The point is well made. It is our desire all along is to have visitors to be able to meet with loved ones, especially in the last few days of their life, to be able to meet with their loved ones and their relatives. That is always going to be our position, but we also have to respect that there is an increased community infection rate as outlined by Martin, and that will be part of the consideration around visiting. But thank you, Ron.
With respect, Richard, I haven't got an argument with what you've just said. All I can say is, please, with the authors of this paper, note what has been said in this debate.
Thank you. Authors noted. Thank you very much. Drida. Hi, Drida.
Hello there, Richard. Yes, I'm very grateful for those comments from Chris and for the original question from Ron, as somebody who had a relative that died alone in a nursing home in July. I can only imagine how distressing that was for her and how tremendously sad it was for her family to not be able to be there with her. So I hope that the guidelines that come into play in the current lockdown do take that into account. My question was related to residential care homes, and we have been able to support some financially that have been suffering, if you like, from under occupancy. And I wonder if we have any projections about the likelihood of further requests for that support, given the new restrictions that we're going to be under.
Reader, would you hold that question, please? We'll consider it asked and we'll address it during the paper for support for care providers, because that element is absolutely integral to the support that we are offering to caregivers. So we'll just pick it up in that agenda item.
Yeah, OK, thank you.
OK, is there anything else, Reader? No, OK, thank you. I think that is all I have. Jonathan, if you could ask your question, please.
Thank you. Yeah, just a brief one, actually. It was about Martin mentioned a school that was currently closed. And although you might think, well, what's that got to do with adult care and health? Of course, you know, adults work in schools and children have parents, and that has an impact on them. Can you just tell us what the school is and how long it's likely to be closed for? Thank you very much.
Thanks, Jonathan. As of Friday, it was Chancellor's School. I'm not saying it's closed now, and I don't know where. I haven't got that information. I'm not close enough, but we can make sure that the people that need to know, not least the parents and the community, are fully briefed on when it's likely to open. But I don't have that information. All I know is that it's the first one that's been closed.
Okay,
Thank you.
Thank you. William. William Whitelow, you might be muted, William.
Yes, I'm back. I did actually put my question into the chat box. However, I just wanted to go on paragraph 7.3.6 again, like Ron. There's some wording there about and must be tested, which is unclear in this context. I hope it's not being rolled into a sentence where it could have two meanings in any other context as well. But I'm interested in where the figure of 28 days came from, given the 14 that is used most commonly, and they wondered why the doubling of that.
Okay, that's a sort of that's a technical question. Chris, do we have an answer for that?
I mean, that's based on public health guidance around the likelihood of if you do talk about an individual that's self-isolating, then obviously they're in a confined position within a household. Clearly, you've got lots of elements of communal areas and so forth. So, to take the principle of caution around further spread within a care home, a 28-day position is believed to be best at this stage in terms of maintaining a reduction of risk in the future. And hence the 28-day, which is longer than the one that would normally be applied for individual circumstances, because of course you're talking about highly communal settings.
There we are. Thank you, Chris. Thank you, William. I'm just checking. Nigel, did you have a further question, or was that yours answered?
No, I had other questions, I'm afraid. I mean, I did want to just talk briefly to that 7.3.6 again, and we had a suggestion, I think, was it this last panel, or it may have been a different panel, maybe public health, about there's been a move to try to get carers tested and treated as key workers effectively, so that one member of the family can visit more regularly. Is there any progress on that? And I just want to comment on the 28-day thing. I do think we've got a really difficult balancing act here, as I'm sure you're aware, Richard, and everybody else involved, in terms of trying to protect homes and their residents, but also to allow families to have some sort of contact with elderly relatives who are, even if they don't have dementia, it's still a tremendous burden not being able to share anything with family for such a long period. So I hope I hope we're trying to be really good about how we assess those risks. But the other thing I just wanted to point out, which I just highlight really in the report, was the effectiveness of the weekly testing and how well that has done. And I think it's just so important, and that government understand how important it is that testing of all care workers, regardless of symptoms, and key workers generally, regardless of symptoms, is in controlling this thing. And I think that the fact that we have been able to control as much better than we were earlier in the year the outbreaks in care homes is testament to that. And I think the question that comes from that is, can we do the same for teachers and staff in schools? If we are going to keep schools open through this next month of lockdown, then surely that should be a massive priority, because there is, and Chris himself was telling us the other day, I mean, there is evidence now that particularly 14 to 18-year-olds may well be a strong locus for this, the transmission of this virus, certainly in other parts of the country. And I think that's my major concern at the moment, looking at the data across the piece. We're slightly more comfortable in Hertfordshire than many other parts of the country, but I think it's still a big risk factor.
Thank you, Nigel. I'll bring Chris in a moment. I think it is worth noting that infection control and its imposition with and supported by the care provider market has really helped as this second peak has ramped up. And this isn't something that arrived in the last week or two. This has been ongoing now since early September, and we're now at the end of October in terms of second peak. And we have seen staff, both asymptomatic and symptomatic, in care homes, but because of infection control measures, this hasn't been translated into, if you like, rampant, out of control infection through care homes, and residents have been protected in that way. Having said that, we do know that one of the major concerns nationally is that when the community levels of infection rise, that puts a lot of pressure on care homes, for example, and other care settings in terms of staffing, bringing into care homes. So that's just on that point. And just to reiterate what I said to Ron about visiting, we have gone the extra mile in terms of pushing the guidance as far as possible. But as you quite rightly say, Nigel, it is that balance between the needs and the wishes of individual residents versus the infection potentially coming into the whole home and affecting everybody in the home. And that is the very, very difficult balance we all have, and the care providers themselves have, across their care homes and their care home estates. Chris, if you'd like to come in and pick up any other points, thank you.
On 7.36, Nigel, on your point about the two or more cases, and then the 28-day resulting, of a cessation of visits. Probably not as clear as it might have been in that paragraph that we had a policy of that being 1, and moving to 2, I think allowed 40 more homes to continue visiting. That's because what we're seeing at the minute, thankfully, is a number of small outbreaks in care homes. So that looked like a minor change, but actually that brought into play 40 more homes to continue visiting, which was positive. On the key worker scheme, there is going to be a national pilot on that, which we signalled an interest in being part of. That's beyond our immediate control. The issue there will be, critically, I think, suggest the availability of testing for those individuals. We need to make that a process that's very transparent and open, because clearly, in the first instance, we might be able to offer that to everyone, and we'll need to be seen to be fair on how that's applied and how that works. So we're waiting for more details on that. We are working as officers in the background on how we might make that work if we were to be given that pilot status, and to think through how we might do that.
In terms of testing, it's my understanding that testing is more timely at the moment and improving. And as you'll know, I was sufficiently disappointed by the announcements back in late August, early September, whereby we weren't able to do the 7-day and 28-day testing effectively, and then wrote to the appropriate minister. So sorry, chief civil servant in that area. I think we have to, I think, Nigel, echoing your point, testing is just vital around care homes to minimise infection spread, and we'll leave it at that. Thank you. Has that covered your points?
Well, apart from the schools.
Schools.
Yeah.
Who could pick up on the point Nigel raised about schools? I don't think I'm the right person to answer that.
Tom's got his hand up.
Sorry, whoever's got their hand up, because I can't see that. Can you please come to the screen and answer Nigel's question? Thank you.
Tom Hennessy, Assistant Director.
Thank you,
Tom. And apologies, I haven't got a shirt or tie on. But in terms of testing, teachers like DomCare, well, I think you framed your question really well, Nigel, in terms of the real trick going forward is to have effective and efficient testing, which is what Richard's just supported as well. Teachers like DomCare workers are considered to be key workers, and therefore they can use the testing centres. We've got, in fact, we've just reduced one of the testing centres in Hertfordshire because of demand. So I imagine that will come back again. But there are testing centres across the county where teachers and particularly DomCare workers, who are the front line, of battling this pandemic, so they can access it. Unfortunately, they're not considered in the same camp as NHS workers or staff who work in care homes in terms of the regularity of that testing. But testing is available. We do understand as well that they're constantly looking to try to both improve the lab capacity in order to improve the efficiency of getting the results back, but also there are other testing regimes coming on stream, which hopefully will improve the speed and the reach. But unfortunately, it's not with us now. But it is something that is very much on both the government, but also the local authorities' mindsets.
Are we actually encouraging? It sounds like they're not taking up that option. Then are we encouraging schools to try to get their staff to have a weekly test?
I'm sure they are. I can find out for you, Nigel. I know obviously our focus tends to be on the care sector.
Yes.
But I will ask colleagues in children's services what they're doing. But I would be absolutely confident they are.
Yeah.
Equally, we know that Public Health Hertfordshire are incredibly active with all the schools in terms of supporting them, their infection prevention control, and also advising them on how and when to cohort the students so that they can try and maximise the learning. If I can say, there was one thing around the impact this time round of COVID in terms of, I think, Richard, you said that there's been an awful lot, we've learned an awful lot from wave one in terms of the measures and the process and the training we've got in place. And it does feel different, whilst the numbers are obviously starting to cause a great deal of anxiety, which is what precipitated the national response. But I spoke to the chief operating officers in both the acutes on Friday, early Friday evening, and both are saying whilst the attendances for people with COVID symptoms and COVID positive patients are starting to increase, the age profiles is different. Whereas in wave one, it was predominantly people over the age of 65 and or with underlying health conditions. They're starting to see a more of a varied mix of people presenting with COVID symptoms. And I think that, again, supports that it is the 17 to 30 years of age who are most affected by this wave. But because they tend to be younger and hopefully more healthier, it's not then translating into the kind of health impacts that we saw first time round at the moment. But obviously, it's something we're concerned about on our monitoring.
Okay.
Thank you.
Thank you, Tom, and thank you, Nigel. I do hope that when we come out of this lockdown in 1 month's time, that as a result of lockdown, the infection rates across Hertfordshire will have declined, which will take pressure off both our health services and our care services. But equally, I would hope we can then step back to tier one, which would allow a normality to resume before Christmas. And I think that has to be the aspiration for all of our residents for Hertfordshire. And I can only hope that that will happen. And I think some of what we heard this morning gives us hope that that can be achieved. I have no further questions or comments to be made. Can I thank Martin and Stephen and Alex for presenting this morning and giving us that wider and broader, deeper context for COVID and our response to it. I'm grateful. The financial situation obviously keeps evolving, especially as grants come in to deal with specific issues that arise. But colleagues, could I ask you to note the report, note our response. I'm just going to be more specific. Panel recommends to Cabinet that it notes the contents of this report, including the planned approach to dealing with the financial implications. That's our recommendation to Cabinet. That will come. Thank you. Colleagues, I'm grateful for your support for that to go through from our panel through to Cabinet. That's excellent. Thank you. I'm going to move us on now to agenda item 6. And somebody in chat might wish to put which page number that starts at in the report. This is to be presented by Jackie, who at one point did a classic student, albeit not that she is, and pulled an all-nighter to get this paper in shape. And I'm really hugely appreciative of the people that have worked on this to make this happen. This is to support to care providers and our ongoing support to care providers. You will be aware that this came to panel in September, but at that point, we were only addressing the issue through to the end of December. This paper will address the support available all the way through to March and give certainty to the care provider community. Jackie, are you with us?
Yep.
Yes, I hear. Can you see me?
There we are. Thank you, Jackie. That's great.
Thank you, Chairman.
If you could give us the key points to this really important piece of work. Thank you.
Thank you, Chairman, and good morning. Support provided for care providers to date has been with additional costs for PPE and for their additional staffing costs to do with infection control, and in addition up to the end of September with payments to support with under occupancy. The payments for the additional costs for PPE and additional staffing are currently agreed to the end of December, and providers have really welcomed this support, and it's have mentioned in a number of forums how much they appreciate the Hertfordshire approach. Since agreeing the funding in September, the government has made announcements and provided funding through the Infection Control Fund, which covers elements of the additional staffing costs, and have introduced free PPE through the National PPE Portal. This paper proposes that we extend the support for providers for staffing costs and PPE that are not covered by the Infection Control Fund and by the PPE Portal. And as a result of the funding we've received, we anticipate that being able to extend to March can be funded with no extra call on HCC funds, and that's explained in the table in section 8 of the paper. In answer to Dreda's question, which she asked in the previous item, the care provider support for under occupancy, we had a proposal in place and ran that to the end of September, and we in the paper that came to panel in September, we changed the process slightly to make it more targeted to providers who are in difficulty, and there is a process that is detailed in that paper under section 6.9 of the paper that came in September, details the proposal that against which the criteria of each of those proposals would be considered. I don't know if Chris wanted to say anything else, or that's.
Again, the key point here is a targeted approach, looking at individual circumstances of particular providers. So far, we've not seen, I think, as Dreda asked, a significant rise in the number of providers asking for support on that basis. We will keep that under review. Indeed, we will keep that policy under review as the winter develops. But as yet, no major concerns around individual homes or those volumes increasing. But we'll keep a very close eye on that. And there's a clear process for the agreement of such support through Assistant Directors for Operations sign off. So that we can understand where that's going, and we keep a very close track of the pattern of such requests and the location of such requests, and we will continue to do so over the winter.
Chris, could I just ask, or Jackie, while you're there, there is an assertion that the drawdown on sustainability may be reduced because numbers have started to increase in care homes. Has that been sustained in recent weeks? Do we know the answer to that?
I can come in there. We've seen some increases in some care homes, and certainly not a continued fall. So they've either been maintained or increased on the whole. Still not at the levels that providers would be comfortable with, clearly, but have stabilised. But we look at occupancy crucially, I think, district by district, because the occupancy levels have varied a lot depending on the nature of that care market, the nature of provision, and also from the impact of the pandemic the first time around.
Okay, that's really helpful. Thank you. I'm going to bring in Ron and Nigel Bell. Sorry, I'm going to bring in Ron, then Nigel Bell, then Nigel Quinton.
Thank you. Thank you very much, Richard. It's just a very quick question. On page 201, on the chart, finance chart, there is a line where it says available funding from. It then follows ACS care purchasing underspent 10.4 million. I'd be very interested in how we can't spend 10 million in the middle of a crisis.
Sadly, Ron, there is a very simple answer to that. We have lost a number of our residents in care homes. Does anybody else have anything further to add? No. Okay, that's why.
That's the understand. Okay, fair enough.
Literally, there's fewer care. Yeah.
You look strange in the financial accounts.
No, it's a reality of COVID.
Lovely, thank you.
Thank you. Nigel Bell.
Thank you, Chair. And it's just really going over the point about the costs, and obviously 8.5 saying that the overall extending support to providers to March 2021 is now going to be the same cost. And obviously it's previously calculated that providing support beyond December would cost approximately 7.6 million in additional expenditure. You know, I just wondered if that could be explained again. Obviously that's good to see that it's going to be the same. And just without, I know it's a totally separate thing, but looking at the equality impact assessment on page 5 and 6, maybe this is for Jane, obviously on the question of how the BAME community can be affected, what particular measures have been put in to take into account those effects on now 18% of the BAME community?
Okay, thank you for those 2 points there, Nigel. In terms of Jackie, do you want to come in and just cover the funding point?
Of course. So what the impact of the infection control covers some elements of staffing for providers, and so that's reduced the call the amount we'd need to spend per month on supporting providers for their additional staffing costs, and we've estimated that based on what we thought the existing cost would be, and we've reduced it for the element that they've received for infection control. And we are assuming in the numbers that 50% of the PPE that providers need will be provided through the portal. Now that's quite a prudent number, because in terms of the provision at the moment, we haven't got any intelligence that's failing, but we weren't entirely sure when it first came in. There are some limits on the amount of PPE that providers can claim, so we've put in a prudent estimate based that we would have to fund half of what the PPE is. So that's the basis of the numbers. So basically the cost for us to support it's us filling the gap in terms of funding, rather than us providing all of the funding for the additional costs.
Okay, that's clearer now. I understand. Yeah.
Yeah. Okay, that's helpful, Jackie. Just picking the point up around BAME and frontline care staff and additional support for them at this time. Chris, did you want to come in on that?
Well, just to say, one of the reasons that we've tried to make this package of support as comprehensive as possible is to recognise that in any staff group, and based on a number of factors, whether it be BAME, existing health conditions, age, etc., different providers will have different risk profiles with their staff groups, and come what may, that requires more funding to support further bolstering of staffing ratios if people need to be self-isolating or taking on different roles. And that's really what the aim of the Infection Control Fund from government has been, is to make sure that money goes to providers as quickly as possible. Ultimately, our approach has been to make that support as wide as possible, to give providers as much flexibility as possible to respond to those different needs, and crucially to get the money out as quickly as possible, which I'm confident that we've done.
That's actually, thank you. Nigel Quinton, if you could come through. Yeah. Oh, okay. Right. Nigel's not asked me. That's fine. No worries at all. I do apologise for those that you can hear. There's a drill going on in the background. I might go and shoot somebody in a minute. So Drita, you've had your question. I'm just checking that we haven't had any further questions. That's absolutely fine. I would just like to thank Jackie and others in the finance team for pulling this together. The sums involved here in the support that government has given to us, and then we have interpreted that support about how we wish to support the care provider market, are extraordinary. The run rate is £2 to £3 million a month to support with PPE, extra staffing, and of course the sustainability, making sure those strategic care homes that we need across the county are able to stay open with the appropriate number of beds for our particularly for our elderly residents, and particularly in nursing as well. This is a huge package of support, and the government's grants, which for infection control run to some £24 million, I believe, in 2 tranches, really have helped us to be able to put this package straight through to care providers. And in fact, the national model in how this money should be rolled out was based on how we dealt with it in Hertfordshire the first time around. So it is quite humbling, actually, to our staff who've been working on this, that their good work is recognised nationally. I think that is all I have to say. Creating that certainty all the way through to March is really going to help us, especially now we're in national lockdown. And then we're not out of the woods even after Christmas, I suspect. Fingers crossed for a vaccine, and of course our care homes and our care home staff and our nurses working in our hospitals will be at the forefront of any opportunity to take that. I'm going to now read out some really boring words around the recommendation to Cabinet as far as this paper is concerned. Please bear with me. I'm doing that as much for those who may be watching as for anybody else. Recommend to Cabinet that it agrees further financial provision for all commissioned care providers to meet the ongoing additional costs of COVID-19 that are not covered by the government funding and support until the end of March 2021. Notes and endorses the Interim Director for Adult Care Services' intention to fund this support from the Adult Care Services care purchasing budget. Agrees that the detailed funding support package for care providers described is delegated to the Interim Director of Adult Care Services in joint consultation with the executive member, that's me, the executive member for resources and performance, that's Ralph Sangster, and the director of resources, on the basis that this decision should not increase the call on the county council's budget. And of course, the reason we can do that is because of the government funding in the first place. So with that being the recommendation, panel, could I ask you to ideally support, but to support that recommendation? Thank you. If you could do that in chat now, that'd be appreciated. Okay. I think from the number of those that have agreed to support, I suppose I should as well, shouldn't I? There we go. That's it. Can I thank you for the endorsement of this paper, and I will take forward your comments through to Cabinet when it meets. Thank you very much. That is agreed. I'm grateful. And again, Jackie and colleagues, thank you again for pulling this together. Really appreciated. Good. Quick check on let's what we'll do is we'll take item 7 and then we will have a break after that of 10 minutes. Our agenda item 7 is a I said at the time when we discussed it, I bring this back to panel, and I think it's really important that we have an update, which is around the Adult Disability Services short breaks review. And this, you will know, was the closure of 3 of the short break settings. And the reasons were given back in our panel meetings earlier in the year, and they were challenged by our opposition. But now we have moved on and we need an update as to where we are in light of all the disruption from COVID. So could I ask Mark to bring forward his paper, please?
Good afternoon. It's okay. Are you able to hear me okay, Richard?
I can hear you all right. For those of you you don't know, Mark Harvey is the Assistant Director, i.e. is in charge of all of disability services in Hertfordshire, which covers those with learning disabilities, physical disabilities, and a lot of others as well. He's also the nation's senior social worker. Mark, thank you.
Brilliant, thank you. So I will just quickly run through the key points in the paper, and I have got a couple of additional updates to give you, as obviously this is a quite fast-moving piece of work. So I can just update on some of the numbers should people just want to check those, ask any questions. So just obviously due to COVID, we did pause this piece of work as the start of the first wave of COVID, and wrote to all families and individuals that were concerned. We recommenced the work in August. Everyone was written to. We reproduced the Q&As to both families and staff and those individuals that are using the service, and wrote out to those. Of the original 112 that was represented in the original papers, that number that need review and alternate provisions has now actually reduced to 77, and the paper sets out some of the reasoning behind that. People have chosen not to take short breaks, or they've taken alternative arrangements themselves prior to that. As at the time of writing the paper, there was we'd completed a reasonable chunk of some of those assessments and commenced the work, but I can update today of the final 77, 70 of them have now either had their initial contact and meetings with social workers or have actually had the assessment phase completed. So we are moving quite rapidly through those phases as we go. Of those where we have completed the work, and again, further to the original panel report, another 15 have had plans set out, and we're in the motion of setting those support plans up. So just to really update on the numbers, of the 35 now where we have made arrangements or are starting to commission those arrangements, 4 individuals have decided to take direct payments as an alternate to short breaks. 3 people have decided to explore and move into short, what are called shared lives projects that we run in the council. 3 people have decided to take a mix, so a bit of a direct payment, maybe use a reduced amount of short break nights in the system. 16 individuals of that number have decided to look at one of the alternative short break units that are available across the county as an alternate to their unit where it's closing down, and 9 individuals have decided to move into supported living services. Some have already moved, the others we're starting to make the arrangements for them to move in, and obviously have to be mindful of how we do that through the COVID period as we go forward. We gave you a brief overview just as a bit of an update around how COVID has impacted on the use of the short break services, and understandably we've had quite a big reduction in use of short breaks, but we have kept them all running throughout the period. I have also mentioned in the panel that quite rightly the council has been doing health and safety reviews of all of our short break units about the level of capacity we can use in them, and the amount of people that we can make use of both currently and what the future implications may be like that. And what we've done is modelled a worst case scenario should we have to reduce some of the bed units. And if we did see a reduction of 25%, that's getting to the point where we can just about meet all of the need with the ongoing programme, but we start to get to the world where people may lose their first choices, assuming everyone opts to keep going into the short break units. And obviously we're seeing that reduction of people taking alternate options for their short breaks or their respite as we did work with them. The health and safety review isn't complete, but at the moment the worst case scenario they're actually looking at is about 20%, but that is also with the opportunity for mitigation. So they're coming back and saying, but if you did this, or if you employed a cleaner here, you could go back to full capacity. So we actually see the impact as being quite small. And interestingly, the biggest impact is on those units, which are the ones we're looking to close because they're more dated, they're less modern in terms of opportunity for us to be able to push through. So we do think we'll quite easily be able to meet the capacity should everyone choose to carry taking short breaks from us as a council in the remaining 5 units. But as I've said, we're actually seeing anywhere between 40 and 50% of people choosing alternates as it stands at the moment.
Mark, that's really helpful and quite a dramatic change. Some of those changes were in fact implied in your report earlier in the year, particularly around supported living, but also those opportunities that are out there in the community, right across the private as well as the public sector. I have got a number of people who wish to ask questions and comment on this, and that's the whole point about bringing this to panel. Nigel Bell.
Thank you, Chair, and thanks for obviously following this up, which obviously I know from residents I'm in my division. I know others had a lot of concerns about this, obviously back from February. I was concerned about, obviously on page 217, where it does say all reviews will be scheduled by mid-November. So I just wanted to know if that is the case. And also, obviously, with the latest lockdown from Thursday, on this transition document 310, how is that going to affect it, and any revised timetable? And I also know that residents I've talked to, although as I say, Linda Morrison is working very well with those residents, but I've been told that virtual tours have not been made available yet, or not to everybody. And another, finally, in the more particular about Tanner's Wood, 4.9, it says Tanner's Wood to be completed by February 2021. Obviously, with the residents I'm working with, their son is in a wheelchair. It wasn't accessible. Does this now mean that it would be fully accessible, Tanner's Wood, to wheelchair users properly, and there will be activities there? And as I say, it says by February 2021. Can that be confirmed, whatever happens now with changing of lockdown timetable? Thank you.
Brilliant. Thank you. So in terms of the reviews, we're actually ahead of the schedule we put into the paper. So we expected them all to have been done by mid-November. We've actually done 70 of the 77 now. So we do think absolutely we'll meet that timetable. That then allows us the more important time, which is actually talk to the families about the personalised approach to that plan and making sure that it's the right thing for them with transition periods. In terms of the virtual tour, I understand that they are all now recorded and due to be published this week. So I've had sight of a couple of them, but I'm sure by the in-house services they will certainly be all out this week. The idea of the virtual tour, obviously allowing people to have a look and then decide if they want to then go and visit, because obviously we want to limit visits, understandably, but whereas then actually it is seen as a positive next step for people, we can then make arrangements for safe visiting to that. And in terms of Tanner's Wood, yes, we do envisage all of the work will be completed by February, because some of that work was ongoing anyway through the last lockdown period. The wheelchair accessibility, that's as much an issue about the fire regulations as it is the actual work. And we are fairly clear that we will be able to get Tanner's Wood up to full capacity and running by the time that we need it to be at full capacity in February. There might be some work we will have to do in how we plan the rotas. So, for example, we couldn't have 3 or 4 people that are wheelchair dependent using it at the same time just because of fire risk. But that's an existing issue as it stands now, and I'm well aware of the case that you refer to, and we have written to that family and really talked to them. And we are confident that Tanner's Wood will be able to meet that need going forward. In the meantime, we will continue to meet need as we do with the current 8 provisions.
Okay, all right. Thanks, Richard, and thanks, Mark. I'll go back to the family and also, note what you've said on the other ones and about what you've said about the video or the virtual tours. Thank you.
Thanks.
Thank you, Nigel. That's appreciated. William.
I've been looking at a business which operates a sort of similar timescale with the 1 to 4 nights typical, and that is Airbnb. They seem to manage to do a turnaround time of 7 hours to move from one person using a facility to another. Are there any lessons that we can learn from that? Is that the sort of target that we can achieve?
In terms of turnaround time for people leaving short breaks and someone else coming in, I suspect we do achieve that already. We don't generally have long periods of gaps where people are needing to use them. The gaps are generally generated by lack of use of the unit. So we would have scenarios where someone may be at short breaks, return to their family at midday that day, and someone else coming in later that day at the end of either attending from day centres or other day activities. So I suspect we probably do quite well on that. We are certainly taking some learning on how we book short breaks in our in-house services. Now, Stephen Lee Foster has led on a piece of work to make that booking process more visible to people so they can see when there is an opportunity for them to book and actually a smoother process, which I suspect from Councillor White, we will be learning from some of those elements in wider sectors.
Thank you, sounds good.
Thank you, William. Helpful. Nigel Quinton.
Thank you, Chair, and thank you, Mark. And whilst we welcome the work that's being done, obviously, to seek alternatives for the people affected by the closures, just like to put on record again that it was only the Conservative councillors who chose to go down this route. We still remain unconvinced of the case to close the 2 units in the west of the county, particularly, noting that the geographical imbalance is quite marked now. And I just wonder, the 2 things really to raise. One is, with the contingency planning for capacity constraints, it's very noticeable from item 7 appendix B that if you just kept those 2 units open, you would not have a problem. It would fill the potential gap almost exactly. But also, and probably more importantly, back in February, I mean, one of the key points we were making was that you had scheduled a review, user-led review of the service being offered. That was being demanded by a lot of people in the consultation. We always felt that should come first before the closures, and we were putting the cart before the horse. There's no mention in this update of what's happened with that review. Is anything happening on that? Sorry, Mark, you muted yourself.
Sorry, that was my best point as well. Sorry. Yes, the review to develop the new strategy and the work going forward has started and commenced, and we've held a number of sessions with carers and individuals who use the current short breaks. We haven't been able to give it the pace we would want, because obviously families quite understandably are not wanting to engage in any obviously face-to-face arrangements, etc. So we're doing a lot of that via virtual arrangements. We do have a set timeline, which I can pass that on going forward, but we expect that ongoing work will continue, and that we will publish the strategy in around March next year, once we're confident that we've co-produced as much as possible about all the other wide alternatives and learned from what people are choosing to do as part of this work. So it certainly is going on. We're working very closely with carers and Hearts. We need to improve the access to people who are using the actual services, so we can get a better understanding from them what they want. And I think what's absolutely key in this, and where the commissioning leads that are doing this work, is our work with children's services, because we know that by far the biggest need for short breaks and ongoing care arrangements are for those coming through 18 to 25 services, and they're the ones who are choosing alternates. So we're focusing quite a lot of work in that area.
Thanks very much. I mean, I'd just like to reiterate, I do think the priority should be that rather than the closures, but we are where we are.
Yeah. Thank you, Nigel. Nigel Bell, you may have put a comment in chat. Just if you'd like to make that in a public sense, I'd be very happy for you to do so.
Oh, thank you, Chair. No, I was just agreeing with what Nigel had just said just now about obviously on the closures, and going back to his first point that he just made. That's all. I was just agreeing with him in chat. I mean, I know that's not public, but
no worries. Thank you, thank you, Nigel. I'd now like to bring Ron in.
Thank you, Richard, and hello, Mark, and well done, and for what you're doing generally across the piece. However, you have upset me slightly, because, as Nigel had just said, and he covered part of it, when we had the discussion on this whole issue earlier in back end of last year and early this year, I was firmly I understood it firmly that the user and carers would be involved in preparing a strategy and a way forward, even possibly a timetable, before the council moved on this issue. And it seems that your answer to Nigel, that the user conversations will not close until next March, does seem to defeat the purpose, seeing as you have created a timetable and plans and are going forward. So I'm very reluctant. I feel very reluctant in supporting this at the moment, because I feel, in order to ensure, plus the fact, of course, what's going to happen on Thursday for a month, I also reflect on the fact that in the crisis of April, we actually we actually started to bring 2 care homes into action because they were needed for certain purposes. Now, I would hate to see us closing units and then finding a bit further down the road that we've got to reopen them for some reason. I would much prefer if this user carer strategy discussions were to conclude, agreement reached, timetable set, and then everybody go forward together, because I think we've got regardless of numbers, there are disadvantaged people at the end of the line in this respect. Quality of life comes into it. It's bad enough at the moment, and I do believe that we should wait and then let your user consultations conclude. Let's see the strategy and the timelines, and then with everybody in agreement, we can all go forward together. So I am minded not to vote on this one. Thank you.
Mark, notwithstanding Ron's point, and perhaps adding to that, could you say something about visiting in respite care or taking up respite care offers during COVID, and all the support given to those of our learning disability community who might have this from our workforce during this time, as part of answering Ron's question, in a sense, and broadening it out a little bit?
Yes, certainly. So I think what we have seen is a massive reduction in the use of short break services in the 8 units and the wider services we commission from other private providers. That seems to be a mix of things. Quite understandably, families are choosing not to use them and providing the care themselves in their home arrangements. Now, that in itself, obviously, we have followed up. So all of the adult disability teams have made contact with those families, because what we want to do is make sure we're offering support in an alternate way, because obviously caring for prolonged periods and the toll that may have on both the individual and the carers, we are looking at alternative supports we can put into the home and look at those arrangements with how we've provided outreach support from our day services, and where we've kept some day services open where it's really key. So we have seen a massive reduction of those that use the respite. Interestingly, I think where we are seeing still people there, it is still those people that technically are using long periods of respite and actually are the ones that should have the opportunity of having their own home and supported living. And we're starting to see some of that details in the datas. Just as a matter of reinsurance, in relation to everybody who's affected by these changes, we are actively co-producing every element of that with them. As I say, so every family and every individual is met with a named social worker, and they are working on the outcome for them personally around what the best options are for them. And as I said, of the 35 we've already got, you can see people are already choosing quite personalised approaches rather than us just moving someone to the next nearest short break unit.
That's really helpful, Mark. Ron, you wanted to come back?
If I may, Richard, just to the point from what Mark said about the usage being affected by COVID, it therefore means that we are constructing a strategy in artificial times, and when we return to normality post-vaccine, which I hope we all do for all our sakes, then it may find that we made the wrong decision. So I just put that comment in and I do believe that Mark's last comment has actually reinforced my opinion. Thank you.
I think I would have to disagree with you, Ron. I think, if anything, what COVID has shown us is that families and those who uptake our clients who use the respite care breaks want a slightly different offer. And I think it was actually beholden on us to do that, to give our LD community, PD community, the opportunity to live more independent, more socially contributive, more opportunity to partake of social activities that a specific overnight break doesn't necessarily provide. And guess what? When asked, they've said yes. So I'm not entirely certain I agree with you. I think the fact that numbers have declined from 112 to 77, and I suspect may decline further, they're not looking for the standard offer that we had in years gone past. and it doesn't jive with the Connected Lives offer that we brought to panel last time and explained in some detail about just bringing people back into the community and that wider socialising offer. So, but I'm grateful for your contribution, Ron, and we'll leave it there. Thank you. I'm going to call Dreda now.
I accept your points. I just feel that this paper does not actually give us anything from the users group or details of the negotiations and discussions that have gone on. That's what I'm concerned about. But I'll leave it there.
Those I think are for the named social workers which are in place, the support right across for this change, and we heard some of that from Mark. So we'll just leave that there, Ron. Thank you so much. Dreda?
Yes, thank you, Chair. I understand that there is a shifting landscape here in the provision that we want to offer people with learning difficulties and physical difficulties. But I take on board what Ron's saying, and I have to agree that I think we should be looking to our service users and getting some feedback from them about the sort of service that they want going forward and how that's provided for. I was concerned at part of the report that says the impact on our current service users is that there's it impacts their ability to get as many first choices in dates of provision. Well, of course, if you lessen the provision that you're offered, I mean that is inevitable. But I don't want this to become a self-fulfilling prophecy that people get so frustrated that they can't get the dates where they want care provided that they just give up on the service, and therefore we can say, oh well, we made the correct decision, didn't we, in the first place? So it does mention in the report too that there's going to be monitoring, and I would like that monitoring to be reported back to this committee at a future date so that we can actually look in detail at the way the service is being provided and what the feedback from our service users is, and how they're impacted by, as I say, the changes that we've made in the service.
Dreda, I think that you make a perfectly valid point. I will agree to your recommendation. I suspect what we need to do is, if this is embedded, for example, in February, if we give it another 6 months after that, so we're talking the autumn of next year to come back with an update of how respite care, but also we will then by then perhaps understand a little more about day opportunities, which we're going to come on to later this morning. I think I'm actually heartened that the view that there were different opportunities for our client group and that they would want to take those up, I think is really, really valid. I'm also I do take the point that's been made this morning. There is a balance here between everything stopping because of COVID, but also against providing some certainty for our client groups in what their options and opportunities are. And I think Mark has got the balance about right. It's not rushed. Yes, it's during the COVID crisis, but it's actually working with our client group to give them some certainty, and I think that's really important. I think we've got the balance about right there with the support there. But Dreda, we'll bring this back to panel in the early autumn of next year. I suspect something like September of next year, to give a really good update on not only with respite care, but how those that have moved out of respite care, how are they doing? Or if they've chosen different options, how are they doing? I think that would be really helpful. Thank you.
Thank you, Chair. Is it possible for that to be written into the recommendation? Or
yeah, absolutely. Yeah, we'll do that.
Thank you.
We'll do that. Lovely. Andrew Stevenson.
Yes, hello. I really just wanted to say well done to Mark, because I think that what I heard was a reasonable and sensitive approach to what is a difficult situation for the people that are affected. And certainly, I mean, I had a constituent that got very, very worried about this. I haven't heard from them recently on it, but I think a lot of the issue was that change is very difficult for people that we're dealing with in these situations using respite, and the unknown element of it causes a lot of stress. So I think that the sensitive way that Mark is handling it is very much to be applauded. And I think, quite frankly, certainly from my constituent experience, it's the sensitivity of the way they're dealt with is far more important than getting involved in strategy meetings. I don't think they want to be really involved in strategy meetings or user groups. I think they want a sensitive and reasonable approach. And from what I've heard this morning, I'm very happy to support this, because I think that's what we're getting. We're getting a reasonable and we're getting a sensitive approach to people in difficult situations.
Thank you, Andrew. That is helpful, and particularly with your user experience as well, and others' thoughts I've just had. I appreciate your comments. Thank you. Panel, including, and Elaine has picked this up already, the recommendation that we have a further update in the autumn of next year will be part of the recommendation. I find the comments and your thoughts and questions really helpful in holding all of us to account on this. Mark, thank you for presenting the update to us. That's really important and quite revealing as well. So panel, can I ask you to note and comment on this report, please? In chat, that is. Just to be clear, this isn't going through to Cabinet. This is an update on the actions that were taken. I just thought it was really important. We said we would come back, and it's. I think that's what this has achieved. Okay. I'm just going to, for the benefit of those who are watching who may not have seen the chat, I'm just going to. Ron has managed to note the report and abstain at the same time, which is I'm going to take your a second attempt, Ron, which is to abstain, and Nigel Bell's abstained as well. Nigel's noted but cannot support the strategy, understand, and everyone else has agreed. So this report is noted in a majority way and agreed in a majority way, but those abstentions are noted, and I hope that's been done publicly and transparently. Thank you. Mark, thank you so much for bringing that to us this morning. That's great. I'm now going to give us, it's now 1 minute past 1:45. If I could ask you to be back at 5:02 to resume. So go and grab yourself a tea or a coffee, have a walk around, get away from the screen, and we'll see you back here at 1 minute past 5:02. And let me just check. Yeah, okay. Elaine, if you could just come on, my watch and Okay. Thank you. I hope you were able to take advantage away from the screen for 10 minutes. That's just what we needed, I think. But as colleague Ron mentioned, we've made good progress this morning. I'm grateful for the quality and the quantity of debate when we've gone through this as I was hoping we would, a little bit quicker than we do normally. So let's see how we can crack on for this second part of our meeting this morning. I slight apologies to Mark Harvey because we kind of got in between two items. So Mark, if I could invite you to present your paper, Community Opportunity Strategy. And first of all, my thanks to Nadine Renker, who was the author of this paper. My thanks to her work on this. And Mark, you may wish to introduce anybody else who's put some serious effort in this area. If you'd like to take it away, thank you.
Brilliant, thank you ever so much. So I'm just really wanting to introduce this paper for noting as the culmination of what actually has been quite an intensive year to 2 years piece of work around the future strategy for day opportunities in its broadest sense. So we did start this journey as council, as I say, a couple of years ago. Our ambition to kind of embrace a new approach to day opportunities, which takes on board more than just traditional approaches to day centres and day respite provision, but goes wider to ensure that those who want to use our services or who are in need of using our services are able to get the best possible outcomes, to be enabled to reach achievements and actually develop their, for us to be able to work with them to ensure their aspirations are understood and met. So this has been a long piece of work where we have actually co-produced in quite a level of detail with various organisations, individuals and groups as we go forward. And this is the culmination really of that strategy. The strategy, as you'll see in the paper, is broken down into 5 key work stream areas at the end of the document. And just for note, so 3 of those work stream areas will require us over the next year to be looking at active procurement programmes in relation to those currently contracted providing adult social care services, day opportunities provision, as well as those in the third sector and the way we issue our grants for local charities and third sector organisations that provide alternate day opportunities through grant mechanisms. And the third change area is our own in-house services, who are actively looking at the transformation of those day services so that they're able to broaden their offer and meet a wider set of needs across all of our citizens in Hertfordshire. As I say, the key ambition of this document is one, to make sure that our offer is brought fully in line with our ambitions around connected lives, and that at the core we have built in what's called an asset-based community development model, which takes on the very best of what we do in Hertfordshire, both in adult social care, but what our communities do, and again further draws closer together people with disabilities, older people's ability to be part of their communities and meet their aspirations, from whether it be gaining employment through to taking up certain roles and responsibilities within our communities, but most importantly having their need met. And in addition, we've been very mindful that, I know we've had the previous paper on short breaks, but a lot of our carers rely on short bursts of daytime respite provision as well. It's not all just overnight care arrangements, and what we want to make sure is that this strategy is really cognizant of that, but also goes further. So whilst it may be day respite, that the person is also able to develop what they want in terms of their own personalised approach to their learning, rather than it just being seen as a respite approach going forward. And finally, again, this is a very key agenda for us in relation to young adults coming through from children's services. We want a much bigger approach towards employment. We know they're telling us they want to go into work, they want to have meaningful occupation in their day, and we need to look to realign how we do that as part of this strategy, as well as meeting the needs of those people with the most significant challenges, to ensure that we do have an offer for them that it has parity to everyone else who gets access to day opportunity services as we go forward. Thank you.
Mark, thank you. Personalised approach to learning. So not a this is where you go for your 5 hours, but this is where you go to meet your aspiration, to have an opportunity to learn, to work, to be part of your community. I think that's quite important. It's inspirational, actually, and ties in so much with what Tanya was telling us about connected lives. You've referred to it. It's in the report. Connected lives being talked about and being put front and centre to our activities is I hope it makes sense to colleagues, and I hope it makes sense right across our organisation. Thank you. Ron, you were first to wish to speak. Please come in.
Can I say I welcome this wholeheartedly and congratulate Mark and the other officers for their work on this. I think it's definitely the way forward and where we're going. I'd also like to comment and suggest that we perhaps take note of 6.16 in the winter programme, which mentions Hertfordshire community navigators and social prescribing link workers, which is a bit of a mouthful, but still. And I trust that they have been totally brought into this, and so they are aware, because primary care networks can be slightly aside and outside the mainstream NHS, and I would hope that every primary care network is also involved in all this. Just one little point on page 254, paragraph 4.5. I think Mike alluded to it slightly in his introduction, but it mentions impact to providers. Now, I presume that's because of the changes being made, and I wondered if Mark could expand on what impact to providers he was talking about.
Yeah. No, absolutely. So we know that the way we currently contract with providers in the wider sector outside of our in-house services over many years is now a bit hit and miss. So we have very different contracts. We have some being paid at an hourly rate, some being paid at a sessional rate, and the rates of payment that we have are quite different in different parts of the area and different parts of the county. So the impact is that we will be looking, and obviously panel will be made aware of this as we move towards this level of work, is a new framework arrangement for commissioning those services which we purchase as a council, and that we bring parity to the system across the county. That will require us looking at the individual prices across all of those organisations. What we want to do is work with them to ensure that, one, we don't obviously damage their opportunity to deliver day services, but that we bring about a better approach to shared hours, to individual hours, and that we bring about a range of prices that all care providers of day opportunities are aware of and can come on our framework for.
Thanks, Mark. Thank you, Richard.
Okay, no worries. Thank you, Mark. Drida.
Thank you, Chair. Yes, I welcome this report. As you will know, learning opportunities for young people with disabilities, either physical or learning difficulties, is an area that's very close to my heart. I'm very pleased to see that we're looking to explore further opportunities for providing for those particular groups. I did have one alarm bell ringing, if you like, and I do apologise, Chair, because I'm not so adept at navigating around the papers electronically as I might be if I had them in front of me physically, as it were. But I have written down, as I say, the point I wanted to make, which says that, okay, sorry. Well, it's about crowdfunding. It's about that we want to encourage crowdfunding to help finance these activities, and I would be very, very wary of depending too much on crowdfunding opportunities, because of course that does mean that it highlights inequalities of provision throughout the county, dependent on, of course, where you live and what those crowdfunding opportunities may be able to raise.
Just before I'll bring Mark back in, Drida. Really helpful thought from you, and then I'll bring in Chris as well. I suppose what crowdfunding just gives the opportunity for an organisation to connect with its wider community and say, do you think it's a good idea that we could support a programme like this, rather than just a commissioner from a statutory organisation saying, we want you to do this for these people. And I suppose it's just another opportunity for the community to respond, and dare I say it, a little bit like the community responded to COVID by offering to volunteer, but equally how some organisations came forward, treading on eggshells here, but and offered food and free school meals in a completely community spontaneous way. And I think we'd always want our communities to respond like that and to have the opportunity. Having said that, I'll let Mark come back and then bring Chris in.
Sorry, Chair, can I just say before Mark does come back that yes, I do take on board what you're saying, but I think asking for crowdfunding to happen also highlights inequalities in certain areas, because there will be areas in the county that will not, where the community will not be able to crowdfund in the same way that others do. I see it in my local council when they've asked for money, say, for play areas, where you could definitely tell the socio-economic group, if you like, that live in a particular area from some of the play areas that are provided, and I don't really want that to be widespread. Thank you.
Your point is well made. Thank you, Drida. Mark, would you like to come back and then I'll bring Chris in?
Yes, yeah, absolutely. So I think, Richard, you've already mentioned some of the opportunities that crowdfunding brings. I think that the other element in the crowdfunding part of it allows local organisations that may be charities or community groups the opportunity to try something. What I would want to reassure, though, that is different to us as an adult care department meeting people's eligible needs. Now, it might be we work with people that have crowdfunded because they've got a better offer, potentially, but our statutory duties of providing care and support in a asset-based way, an approach under Connected Lives, wouldn't be reliant on crowdfunding, obviously. We would still meet those needs and ensure that hopefully, as part of the strategy, they're delivered in an aspirational way.
Indeed. I think I'm going to agree with Drida, and I'm going to agree with Mark. I think that's the best way out of it for me. Thank you for raising that point, and Mark, reassurance there. Chris, did you want to come in?
Yeah, it was just to say, when it comes to the implementation of this, and when we're looking at contracting and so forth with the existing providers, we will have to keep that under quite close review around how we time that, given the ongoing COVID situation, and when the best time to do such an exercise might be, given likely calls on providers and the challenges that we're all facing. So we will keep that under review and make sure we do that in a way that maintains momentum, given the agreement to the principles within the strategy, but is also done with a fair degree of practicality. Pragmatism based on the challenges that we're all currently facing, because we'll need to make sure those are addressed first and foremost before doing anything that may disrupt that.
Thank you, Chris. That's really helpful. I think that's fine. Andrew, could I call on you, please? Andrew Stevenson.
Yes, sure. Well, I welcome the holistic approach, I think, in this report. I think it's very much to be welcomed, and it may well set, as you alluded to, Richard, a sort of new and sort of aspirational approach that unlocks opportunity from people. And I guess, but it's perhaps a question for Mark, is do you think this will enhance the sort of direct payment agenda as you sort of open up more opportunities and people are making more choices for themselves?
I certainly think it can do. We're already starting to see that develop by virtue, again, actually our younger transitional individuals and families are tending to take direct payments. What this does is allow us to develop our ability to shape that market and give better opportunity for people. It also allows us to bring back what are called individual service funds, where younger people, or actually anyone who's taking direct payment, can club together to maybe develop their own day activity, but also if they want to club together to start up small community-led interactions. And actually I've seen it nationally, small groups of people clubbing service funds together to deliver local services for themselves, and actually they become a local service provider or sector within communities, which is very positive.
Okay, we got a little bit of you.
The sort of thing that comes. So I was going to say that there's I chair an arts hub locally as well, and I think we've tried to open up to people with learning disabilities, and it sounds like this kind of strategy might help that sort of organisation engage. and then even reference to Dreda's concerns about crowdfunding. If the crowdfunding was undertaken by a charity that was set up to do it, say for providing artistic outreach to the community generally, that could be a nice linkage, but it wouldn't be pushing the crowdfunding responsibility back on people that are not equipped to do it. So I think this could open up some very interesting community opportunities. So I really do welcome it.
Thank you, Andrew. I think you hit the nail on the head there. It is that chance for encouraging independence, independent thought, independent thinking, to give confidence to those with learning disabilities, to live the best lives that they can. And that almost sounds patronising, and I do apologise if it does. But our job is to make every opportunity available, and I think this is the kind of approach that will allow that to happen, that will enable that to happen. It's quite empowering, and Mark, appreciate it's tricky navigating this, as Chris was saying, tricky to navigate this over the next few months, and lockdown doesn't help, but this is the direction of travel, and it's important that it comes before panel. So without further ado, could I ask panel to note or otherwise this report, and we will certainly be bringing further updates at some point in the near future. Thank you. That's excellent. Thank you, Mark. Come back.
Yeah, just Richard. Obviously, you very kindly noted Nadina's efforts in this. If I could just note the effort and the work of Gemma Bell and Christy Thacker in developing this, but more importantly, working with the sector to get them to embrace this kind of approach and idea, because I think that's going to be pivotal in us working together over the coming years. So just to thank them.
Thank you, Mark. Just my colleagues will know Christy Thacker heads up the the wellbeing unit and has been so busy, and her team through COVID, and making sure Volsector is absolutely tied into supporting community across Hertfordshire and linking back through to such organisations like our own, and obviously the district and borough councils as well. Where does Gemma sit in the organisation, Mark, if you could help us?
Yeah, absolutely. So Gemma Bell is one of our commissioning managers and sits the Adult Disability Service commissioning team that sits alongside ADS and works to Nadina. Please
pass on our thanks. Thank you for prompting us. Pass on our thanks to all those who've contributed to this paper. Thank you. Appreciate that. And just to announce that paper is agreed, and we look forward to seeing how that all that develops in the coming months. Thank you. I'd now like to take us back to agenda item 3, which is the sustainability agenda, which is follows on from a commitment by the council to respond to very positively the climate change crisis that was highlighted to us last year by a number of groups. Climate change is going nowhere fast. It is something that we need to respond to quickly. The sustainability agenda gives us that opportunity in this panel to understand what our contribution, particularly adult social care with health, can do to help support that programme. Some really ambitious targets in this, not least clean air by 2030 and to be a carbon neutral organisation by 2030 as well. These are really ambitious targets. That's 9 years away. So without further ado, could I ask Hugh Walsh and Simon Aries to present their paper and the key, perhaps bringing out the key points as far as adult social care is concerned. Thank you.
Hello all. Hope everyone's keeping safe and well. I've just prepared a few slides that I'd like to present to the panel, if that's okay, Richard.
Thank you, Hugh. That's great.
Richard, can I just confirm that the slides are available to be seen?
Yeah, that's good. Good visibility on that. That's fine.
Perfect. So just to give a brief overview of what I'll be discussing in the presentation. So just to give a highlight of exactly what we're wanting to deliver as part of the Sustainable Hertfordshire Action Plan, and then how we envisage adult care and health services to be able to support in the delivery of these actions. So just to kind of give a brief overview of our journey so far. So Hertfordshire County Council declared a climate emergency in July 2019. This led to the creation of the Sustainable Hertfordshire Strategy, which was agreed in March 2020. And then the Sustainable Hertfordshire team has been working at a quick pace to be able to deliver the Sustainable Hertfordshire Action Plan, which is how we confirm to deliver HEC its ambitions and the actions that each directorate will take in order to deliver the strategy. Now, just to remind members as to the purpose of Sustainable Hertfordshire Strategy. Now, this is, the strategy outlines our initial policies needed to embed sustainability across all council operations and services throughout the council. Now, these centres on 3 key areas of influence in order to achieve our wider environmental aspirations. So this includes an ability to be a leader in our own operations, enabling a sustainability county with our programmes and policies, and inspiring Hertfordshire residents and businesses to lead more sustainable lives. Now, just to provide a brief overview of the Sustainable Hertfordshire Action Plan. So the Sustainable Hertfordshire Action Plan has been produced to coordinate the Council's response to delivery of the ambitions outlined within the Sustainable Hertfordshire Strategy. Now, the Sustainable Hertfordshire team has been hard at work to condense over 400 actions that were received from right across the council into 200 actions that we want to take forward as part of this process. They've been identified as quick wins, key work programmes, future work programmes, and business and usual activities, and have been highlighted to all members, I believe, in Appendix A, which indicate exactly what actions we want to take forward and how they will be delivered in the future. We've identified 19 key actions that are essential, we have deemed as a priority, and will be essential in determining the deliverability and feasibility of future actions that have been allocated as part of the process. Now, I want to highlight to Adult Care and their health panel members at this particular point. We've identified a proposed lead portfolio holder for each of the actions, who will be responsible for the action's delivery. It is to be noted that the amount of actions attributed to some services may be disproportionate to others. Now, this is primarily due to the high proportion of actions relating to changes needed to the HEC's estate. Now, this is particularly true of adult care services, where changes to the adult care services estate will fall or has been allocated under the property function and will be delivered by the property services. However, this does not mean that adult care services will not be a key stakeholder in terms of these delivery. To kind of highlight this point, we've identified collaborative partners responsible for the delivery of each of the actions identified as part of the Sustainable Hertfordshire Action Plan. Now, with regards to adult care services, they've been identified as a collaborative partner for 19 actions. Now, this will mean the directorate will be required to advise and support the lead service portfolio holder in the delivery of the right actions, which means that, for example, if we're looking at the adult care service estate, they will be consulted with their expertise and to ensure that it meets not only our sustainability objectives, but also will be able to provide support for vulnerable Hertfordshire residents in the delivery of adult care services. Now, just to reiterate the engagement that we received from adult care services. So adult care services have been a really key player in being able to help us formulate and deliver our Sustainable Hertfordshire Action Plan. Now, I just want to, if I can, Richard, highlight some of the key contributions that have been made by adult care services. So first and foremost, adult care services has been key in us identifying the need to develop an energy efficiency programme for locations owned and leased by HEC. This includes establishing a baseline intelligence network across HEC estates, identifying opportunities to deliver decarbonisation programmes across our property portfolio. Equally, we wanted to ensure that the new builds required to deliver adult care services not only meet the criteria that the adult care services have to be able to deliver their service, but meet the high sustainable standards that are required both now and in the future. Similarly, we want to deliver a county-wide sustainable procurement strategy, and we receive support from adult care services on developing this programme of works. So we want to ensure that all purchasing and procuring processes in the future account for the amount of carbon in key products and services which the organisation looks to procure. And then just to follow up, we want to enable staff to purchase low carbon options for private transportation and work with partners across the health and social care sector to embed best practice, sustainability practice, across the sector moving forward. Now I want to be able to highlight the 2 actions that we've identified for adult care services to be the lead service portfolio holder. As I previously mentioned, don't be alarmed by the fact that we've identified 2. We do envisage adult care services being a key contributor in the 19 other actions we've identified as collaborative service areas, but also being an expert in supporting the delivery of other actions as well. So just to kind of reiterate what we highlight here. So for the first action, we've identified or believe that Adult Care Services will lead in the identified programme to support enabling care workers to use low carbon options when travelling to deliver their services. Scoping of this action will be conducted to determine the feasibility and the deliverability of this action and to be able to see if it's appropriate to deliver such a scheme. This will be conducted over the next year or so to be determined whether pilot schemes will be delivered to be able to deliver these actions moving forward. And then secondly, we want to encourage Adult Care Services to work with partners across the health and social care sector to share and deliver best sustainability practices, identifying opportunities to continue to deliver essential services to vulnerable Hertfordshire residents, whilst minimising the impact these services have on their environment and preparing them to deliver it in future climates. We believe this action is highly achievable as established networks are already in place, and we want to encourage the quick progression of this action upon the ratification of the action plan at Cabinet. And just to kind of give a brief overview of the timeline we expect for this process. So we've already been able to deliver this to Sustainable Hertfordshire Board and the SMB. This is the first of the panel processes. We will present the action plan. This will go through all Cabinet panel processes, and we believe that will be concluded on the 10th of December. Cabinet will be then notified on the 14th, with hopefully this being ratified on the 15th at full County Council. And then just to conclude, these are the recommendations I want members to be able to consider. Forgive me for reading off the slides, but I just want to reiterate the importance. So for Appendix A to the action plan, be noted as a list of actions to continue to embed climate change and sustainability into business as usual. To agree the actions identified as quick wins be delivered within existing resources to progress and enable subsequent actions in later sections of the plan. Agree the further investigations be undertaken into the actions identified as key works programmes, and also agree the actions identified as future work programmes to be subject to further scoping as to fully understand the cost and potential carbon impact of implementing these actions. I will pause there. Thank you very much for giving your time, and I welcome any questions.
Hugh, that's a succinct presentation across a vast amount of work, not only with regard to ACS, but of course right across the organisation. Thank you, and to all those, Julie Greaves, for example, who are driving this agenda from within the organisation. That's fantastic. We have got to respond, and this is how we're going to respond. I have got a number of people that wish to speak. I'm going to start with William.
First of all, can I say how hugely impressed I am at the comprehensiveness of this report. It's very difficult to do what I like to do, which is to look for what's missing. So please excuse me if I mention things which perhaps are already in the report. I wondered about whether or not we are or should include something about the sustainability aspect of having trained staff available. We need training mechanisms which will ensure that we have an adequate supply of social workers and domiciliary care workers in the future. Didn't find anything talking about making sure that we put effort into encouraging education, encouraging people into those professions. I also have a strong feeling that we need to encourage people to self-care as much as is absolutely possible right throughout their lives. And that's something which is so cross-cutting that I wouldn't know where you would put it in your report, but I feel that it is very important for our future. And I would also say that I've come across an organisation called Climate Emergency UK, which has a conversation and has webinars involving councillors from many, many other local authorities, but I hadn't noticed any Hertfordshire names in the ones that I've been to. They are encouraging ideas to be sent to them as to what should be in a good list of climate action. And I wondered if it was okay for me to send them your material as presented in this paper, and whether or not you'd actually heard of them and had any correspondence yourselves.
William, thank you for those questions. I might not bring Chris in at this point, but in terms of your point, having a full capacity workforce and the training and the progression. Couldn't agree more. It is the ethos of the department that should be the case. And in terms of supporting domiciliary care, if you remember, we put all of the 2% preset from last year into domiciliary care just to do that, to make it more sustainable, so that companies aren't going round and round the hamster wheel to recruit people who then leave quite quickly. But they also need that progression, and our work with Hertfordshire Care Providers Association, which we support and the sector supports, is so important. And actually, one of the reasons that we've been able to cope during COVID is because of the support that is given to the sector, and last year's uplift, which wasn't just through domiciliary care, but was right across the care market, really helped during this time. So that's that one. In terms of a good mental and physical self-care, I couldn't agree more. I think we absolutely have to return to that agenda. Boris Johnson said you've got to get fitter, and he looks like he has. So we all have to be in good shape to be able to live the best possible lives that we can, especially during our older years. And the Ideas Forum, what a great idea, and I'm sure Hugh may have a comment on that. I'm actually going to bring in Simon Aries, who I notice has indicated to speak. So if I bring in Simon, and then perhaps if Hugh wants to follow up.
Thanks, Chair. Hopefully I'll be able to answer the question to avoid Hugh, but absolutely welcome this being sent far and wide. We're looking for input, we're looking for comment beyond the County Council, so that's very important to us. Right at the beginning of this process, we talked about this being an iterative process. It's going to have to be refined over the weeks, the years, so please do send on. Climate Emergency UK, yes, we have heard of them. At the moment, perhaps it won't surprise you to know there are dozens of groups out there we are trying to engage with, or trying to engage with us. Our focus at the moment is on groups that hopefully can give us some money. So we are working hard, putting in bids to try and bring in money to help support some of our ambitions. But please do send on.
That's great. Hugh?
I just want to highlight to you, Richard, that Julie Greaves, Head of Sustainability, is on the call at the moment, so I'm sure she'll be able to respond to any questions as well. I'll be able to follow up with you, Councillor Watlaw, with regards to providing that information to Climate Emergency UK. I'm assuming that we'll be able to provide at least part of that information moving forward. It's just confirming whether we want to send across the full action plan at this point, or whether we hold off to a little bit down the line.
My advice would be send everything.
In that case, then we'll go that way.
Document. Let's get it out there. Let's get people feeding in and giving us any comments.
Makes sense.
Great idea. Great idea. There we are. There's an action coming from this meeting already. That's fantastic.
Thanks all very much.
Thank you, William. Really good points. And thank you for reading it and then thinking about it before coming to panel. That's really, really helpful. Nigel, and I think it's Quentin. So Nigel.
Yes, and thanks Hugh and Simon. It is a massive report, and I have to admit that I've actually just went through this looking for the ACS references and haven't reviewed the whole thing. So please accept that caveat. So we did rather a lot to read for this panel. And we've certainly, I think as a group, we'll be looking at this quite critically over the next few weeks as it comes to all the other panels. And I suspect probably the Gripe panel is the one that this will get the most airing in. I am a little bit concerned from what I've read through over the weekend in some aspects. And I just wanted to query you put up a slide just now on the two issues that adult care would be leading on. And the first of those had a time frame of post 2030. Is that a misprint?
Which one are we referring to here, Nigel?
This was the first priority for adult social care, which was transport. And I also picked up, it did say post 2030 for completion. So it is. Is your point around ambition, Nigel? Is that your point?
Absolutely. I mean, I think we really have to be much more ambitious. And I know, just going back to the paper, I I note 3.2, agree the actions identified as quick wins be delivered within existing resources. Now, this we have agreed is an emergency. We shouldn't, I don't think, be constrained by existing resources, albeit obviously we always have to be cognizant of resources. So I just, you know, some of the language in here speaks of not being quite as urgent as I think we need to be on some of these issues. There are a couple of other things I wanted to highlight. If you just bear with me, I'm just picking up my notes. Yeah, just a couple. I think this has come up on other panels already. Public health aspects of this, which I think is also hinted at in your notes. I know public health are not totally happy with the breadth of the strategy at the moment and wants more focus on the public health aspects. That came up at the panel last month, I believe. Just on the ambitions, yes, that post 2030 obviously clearly isn't quick enough. There's no reason why we can't be doing that pretty much straight away. And you talked about a pilot.
Tell you what, Nigel, what I'll do is I've got your point.
Yeah.
I think just while you've raised that was the one priority, the other priority was around joint working. I think I'll bring in Chris Badger just to give the department's view on both of those priorities.
If I could just Chris. One other thing before you bring Chris in, Richard.
Go on, Nigel.
Will, and that is the estate aspect. And I was a bit shocked to read it somewhere in here that I can't find the references, lower down in the document, this massive document, where it was talking about the potential impact of solar on our roofs and so forth. And it was assessed as being a relatively low impact, and that surprised me because, I mean, to me, and I've said this at panels previously, I think this one included, you know, every roof should have solar panels. There is no question in my mind that should be the way forward. The cost is minimal to positive, depending on how it's done and what the particular circumstances are. And certainly any new builds, that should be part and parcel of our thinking. And I think there's a huge amount of scope for retrofitting of solar on much of our estate.
Hi, Nigel. I think just before Chris comes in on solar, if it costs twice as much to put a solar panel on a roof as to put it in somebody's garden or a field, I'd go for the field because it's the amount of juice we produce ultimately that matters. But the point you make is valid. If we can do it and we can do it cost effectively, let's do it.
Very rarely is that case, Richard, when you add up all the different aspects and so forth.
I understand.
So,
I mean, I like the 125 acres that we're planning to put in a field, you know, and it's not on a route. You know, I think it'd be more cost effective. Let's bring in the director, see what he's got to say.
I'll bow some of the superior knowledge of my councillor colleagues on solar panels, and I'll let them debate that one later. On the ambition point, and particularly around the vehicles, what we're really saying in here is we need to quickly, and that's much before 2030, look at the feasibility issue here. So what we were clear on was we couldn't look at climate change as a department without looking at the significant mileage that takes place with the wider workforce, not just our own. And we've heard that mileage has actually reduced over the last year because of different ways of working as a result of COVID. And I think some of those benefits will continue after we return to some sense of normality because of new ways of working. But when we talk about our wider domiciliary home care workforce and our move in a sense to create more care at home for individuals and support at home rather than in residential care homes and so forth, has a carbon cost associated with the significant mileage we do. So we thought it was beholden on us to look at how we could, number one, reduce that mileage. So how can we order rounds and logistics in terms of how that care is organised? How can we do that to reduce the carbon being and the miles being used in the first place? Secondly, we know that the technology around cars, the internal combustion engine, and moving to more carbon neutral travel forms is quite an emerging agenda, moving quite quickly, and we know government targets on that are well known. We need to have a look at that to understand what our footprint is in terms of carbon, in terms of that wider workforce, and what we may or may not be able to do to support them and support care agencies in minimising their carbon footprint. We need to do that work quickly to understand that and look at the feasibility. That's not a 2030 issue. That's probably a 2020, 2021 issue in terms of looking at the feasibility, and that's why we've got that commitment in there. I hope that provides some reassurance, Nigel, that we're not sort of waiting until 2030 to do anything about it. But likewise, can't commit at this stage to what that is, because we really need to understand that feasibility.
Understood.
And Chris, just while you were there, sort of, do you want to say why joint working across the NHS, HPFT, our own estate might be really beneficial in this agenda?
Yeah, well, I mean, I think, well, in the same way, it's analogous to why joint working with the NHS colleagues in different trusts and so forth is right for the individual, for the care and support they receive, because actually people prefer to have a much more joined up approach to their care and support, where they often have a single point of contact, for example. We also know that if we do that work collaboratively, number one, we could have a better impact in reduction of, say, mileage or carbon footprint. Two, things on estate is quite interesting. I think we get better outcomes when teams work together in estates, and that we deploy those resources flexibly. There is then, I think, scope to potentially reduce the estate that we're using, and therefore the carbon footprint of that estate, but also look at joint approaches to a more consolidated estate, and thereby freeing up more resources to apply the energy efficiency measures that Nigel and yourself have mentioned is easier to do when you've got a smaller footprint in the first place.
Yeah, Chris, thank you. I'm just at this point, before I bring other colleagues, I'm just going to ask Julie Greaves if she'd like to come in.
Yes, thank you very much, Richard. Good afternoon, panel. It was just really to reiterate what Chris said in terms of the targets and the ambition dates. Absolutely, we need to understand our baseline first before we can start pulling forward in terms of specific actions. So we need to do those enabling works before we can then change things dramatically, and that is going to take us some time. And as Chris also said, there are government targets, and there will be government legislation that will come forward in terms of decarbonising generally, and technologies are moving forward very quickly, and we need to make sure that we're ready for those technologies when they come about. The other issue that Nigel raised was around health, and as you said, we went to the Health and Wellbeing Board the other week, and the conversation was very clear. We do need to make sure we are taking into account health implications of climate change. We've completely taken that on board, and we are now working with the Health and Wellbeing Board to look at the timetable for reviewing the strategy itself, so that we can influence the health and wellbeing strategy. And this strategy is an organic document in itself, and we can then influence the Sustainable Hertfordshire strategy as well.
That's lovely, Julie, and ties in with the point that William was making as well. Go on then, Nigel, quickly.
Very, very quickly, just back on a couple of things that Julia just said. I'm sorry, I'm a little bit, my red lights start flashing when I hear two things that you said there. One was baseline measurement. Yes, it's important, mostly for terms of getting funding from schemes from government, I know. However, I've seen far too many instances where that is used as a make-do work that doesn't ever get anywhere. We saw this at district level 10 years ago or more. And the other one is the fear of technology moving on too quickly. We have missed so many opportunities because we've been too worried that we're not doing the right, something better might come along tomorrow. And I recognise the danger of that, but I think we need to be as nimble as we possibly can in how we make decisions and how we plan going forwards. But to use that to put off the steps that we need to take has been, to my mind, the pattern of the last 15 years on this issue.
Nigel, I'm not going to disagree with you. I don't think anybody would, actually. We do need to grasp this opportunity. We've stated our ambition. This is the action plan, and we have to see it moving forward, because quite simply there isn't an alternative. And you have my word from this department's perspective that we will pursue this with vigour, and we will work really, really closely with Julie and Hugh and Simon and the team to try and achieve that. I think your point is well made. We shouldn't put off to tomorrow what we could try and do today. So that's a perfectly valid ambition. Julie, thank you for that. I've got others. I'm going to bring in Ron now. Thank you. And I've noted that Andrew wished to speak as well. If you drop your hand, Andrew, that's fine.
Thank you, Richard. Yeah, I think it's a good document with which to start, but I'm concerned, like Nigel is, about the ambition, and I'd like to cover just one area. We are responsible for adult care and care homes. There are an enormous amount of care homes throughout the county, some of which we have direct influence in, others where we have partnerships, and others where we have a contact through the association which we set up. Now, this may take some time, but I see this as an opportunity when you consider the amount of buildings and the amount of energy and the amount of carbon use, for us to actually develop a strategy for the care home sector going forward in the county, bringing in all the private providers as well, but leading by example and actually establishing the strategy. We have a 15-year strategy at the moment. We're in the first 3 years of it, where we are tilting our strategy away from residential care into nursing care and also extra care facilities, because that's the way the market's going and more people are being cared for at home. But that still means we've got all those buildings going up, new buildings all the time. And I fail to see why we can't get involved now by setting up some form of unit in which we can develop a strategy which might take 10, 20, 30 years to actually cover the whole of the care sector in the county, to actually work with everybody to ensure that everybody derives their energy from solar panels or some other heat source pumps or whatever, that everybody uses electric equipment, electric vehicle plugs in car parks, all sorts of things like that, and actually insulation standards. There's a whole range of issues which we could develop. And the other thing I think is where money is concerned. I think Simon mentioned about money and looking for money. The government and everybody is throwing large amounts of money at this COVID crisis, which may at the end of the day kill 1 or 2 million people, if that. Climate change and what's coming down the road towards us, if we don't get a grip of it, could actually kill the planet and everybody on it. So I fail to see why we can't start to borrow money to deal with some of these issues, bearing in mind that they are even more dangerous over the years than this COVID crisis, which eventually, hopefully, we can solve.
Okay. Ron, you've made some really good points there, and I'll bring in Chris in a moment. Just to say, independence, living in your own home, being supported to live in your own home, that's not the market deciding that. That is supporting individuals to live the lives they want to live. It's not the market. The second point, I think, about buildings is absolutely right, and our commissioning strategy with the care market must reflect that. It goes without saying. We've got BRE on our doorstep. That's not an original thought from me, but having the national building research establishment in Watford and available to us across Hertfordshire to ensure that we kind of get the sustainability that we want in our buildings, it's a bit of a no-brainer, and some of that work is already ongoing. But I'm going to bring in Chris.
Yeah, I would take Ron's points on board, and that's something we've noticed, that we know that care homes in particular are particularly high users of carbon. What's good to see is that colleagues in the capital programme team in adult care work with Julie, and we were one of 10 local authorities to win funding to do some research in this area with the LGA and the University of Hertfordshire. I think £18,000 to really understand the carbon usage in a care home, what that looks like, what's driving that usage, and therefore how it can be reduced. So taking on those points, Ron, we've actually got this pilot and funding to do that research, which will inform, I hope, both our capital programme, which we hope is going to be extensive in this area, but also research that we can share more widely with the care sector, because clearly there's an economic imperative for them too in terms of energy costs, which is a win-win. So I'm pleased that we're going to be one of 10 local authorities looking at this in more detail with funding in partnership with the University of Hertfordshire.
Okay, that's great. And just, I think, responding to both Ron and to Nigel, your point, Ron, is that there has been a huge public expenditure on dealing with COVID. There will need to be a huge public expenditure to deal with sustainability, especially on the ambitious timelines that we are setting. I fully appreciate that. And where that funding comes from, I hope will be attached to government strategy, which is the most obvious source. But be no doubt we will need a huge amount of funding. So if I could bring in Drida next.
Yes, and thanks to Hugh for the presentation. As a member of another panel, the Development Control, I have to say that the members on that panel have been disappointed with recent applications that have come forward from the County Council, in as much as that they've been somewhat lacking in efficiency measures for school buildings. Now, schools are mentioned, of course, in this report, along with the residential homes that we offer and supported living in adult care services. So I think there should be an overall strategy, particularly for new builds, that when it comes to the planning committee, that it's actually inbuilt in what we require with energy efficiency measures. So that's the first point I'd like to make. And the other is, and I did mention this to Chris during briefing, is on the aspiration for low carbon vehicles for our care staff, who by the very nature of a lot of their jobs are peripatetic, are therefore travelling from place to place. And of course, you know, that emits a lot of carbon into the atmosphere. I don't know how realistic it is that we would expect our providers to provide schemes for low carbon vehicles, given the fact at the moment, the practicality that they're extremely expensive. But I did think that, you know, thinking about this further, I thought, well, perhaps there's other issues here that we could be looking at, and that is in recruitment in areas closer to where people actually work and where the need is. Because I know in St Albans, which is in the area where I represent, that many of the care staff travel in from elsewhere, and there's all sorts of reasons for that, but mainly, you know, wages, I guess, is the principal one. I had a flyer through the door the other day for Aldi's, who are recruiting, and they're offering up to £10.41 an hour. So, you know, we know that what we're up against in that sort of jobs market, but perhaps COVID is going to offer opportunities for more training and for better opportunities for care staff and better pay, and that might feed into this particular problem. Thank you.
Thank you. Drida, that's really helpful. Just picking up on schools, there's a two-form entry school that's going to be built in Bishop Stortford to zero carbon principles, and that will be the basis upon which we'll judge future builds. And I think that will be a really helpful indicator on being able to incorporate that and used as a challenge to all school build. But that's something that's probably wants to be pursued with the school building team and under Terry Duris. But the point is well made. In terms of you know, recruiting nearer to hand, and St Albans is a really good example. You know, one of the reasons we put the money into the uplift last year in terms of care work wages, exactly that, is to enable or empower local people to take up local jobs, and therefore it will minimise the carbon footprint of travel. I really do think that must be part of the ambition. In terms of low carbon vehicles, we've kind of covered this, but would somebody like to just pick up that again? I think that might be useful. Simon.
Yeah, I think Drida's spot on, actually. At the moment, electric vehicles in particular can be expensive. The public charging network's not brilliant. Local journeys are fine, of course. You know, Hertfordshire-based journeys in most electric vehicles are perfectly doable without charging. It's difficult to be optimistic around some of the climate change stuff, but I do remain optimistic around the fact that in the more medium term, this will change. Money will find its way into these kind of infrastructure investments around vehicles. I think people have a different outlook on how they travel.
Yeah.
There's some great examples in France of a little electric vehicle. It doesn't even look like a car, but it will get you around Paris to do what you need to do. And if we can move away from the fact that you have to put a battery in a grey big SUV and just think about what we need transport for, and I am optimistic that will change. So I completely accept, as Chris said earlier, we're not going to be able to hand out electric vehicles to all our social care workers tomorrow. But over the next few years, if that technology, and I agree with somebody else earlier, we've got to make a jump at some point into that technology. That technology will get cheaper. Vehicles, perhaps the use of vehicles will change. COVID has actually seen us all change our habits in terms of how we travel and what we do. So, yeah, it's a big, big challenge, but I am optimistic that things will move forward. They've got to, actually, because it won't be too long before diesel and petrol cars are banned.
Yeah, thank you, Simon. Yeah, it is at the moment a huge burden. I don't know what the actual difference in price is. And if you're interested, there was a really good article in the Sunday Times by Jeremy Clarkson, but that perhaps is for further debate elsewhere. He was saying we've got to start building electric vehicles that really help with local transport, and they might look very different, a bit like the French example that we currently have, which is I'll leave that there. Fine. Now then, Nigel wants to come back. That's fine. But I'm going to take Andrew first, and then Nigel.
Yes, I just wanted to ask Hugh and Simon if in relation to the larger vehicles and possibly also boilers, if you were looking at the hydrogen fuel aspects, because, and I should perhaps state, I do have personally have some investments in hydrogen related businesses. I'm not sure if that's a declarable interest or not, because it's so vague and general and outside of Hertfordshire. But
well, let that slide.
I don't know if Aberdeen counts. But the point I would make is that, well, first of all, I think that a 10-year timescale for large-scale infrastructure changes is actually short and very realistic. And if you embark on things that are not realistic, you won't actually achieve anything. So I don't have a problem with the 2030, and I have had some engagement with National Grid Gas Hydrogen Director, and the change of National Grid Gas over to hydrogen is a 10 to 20 year project. It is actively happening, but you won't turn on your tap and get hydrogen for 10 or 20 years, come what may. But I did wonder if you were looking at that, because I think that for larger vehicles, electric batteries are non-viable, and there's also a lot of work already done by companies like Baxi on boilers for new builds that can be made compliant for hydrogen. So when the hydrogen's available, the infrastructure, local infrastructure, is ready for the national infrastructure. Okay. And there is a good journal called H2 View that I don't know if you know about. William was highlighting climate something or other, but H2 View is probably the international centre of information on hydrogen projects.
Okay, and Andrew, that point is really well made. I think what I'm beginning to say, Simon, come back if you like quickly.
Very quickly, because we are getting off the subject of adult care here into larger vehicle technology. I can certainly talk about hydrogen vehicles in terms of buses and larger transport. Yes, we are. You're right at the moment, Andrew. EV, electric battery doesn't suit the larger vehicles. So yes, buses. In terms of boilers and heating and general houses, yes, again, it's in the mix along with ground source, heat source and all the rest of it. So the answer is yes. And I'm not sure which technology is going to win out on this, but yes, we are keeping an eye on all of them.
That's great. Thank you very much. Thank you for your point. That's great. Just mute out now, Andrew, if you could. Nigel, you wanted to come in, and then I'm going to wrap this up.
Yeah, just very briefly, I won't get into a long debate with Andrew on this, but I don't think he's completely correct on the large vehicle issue. Hydrogen is a viable mechanism for that, but so is electric, and it's becoming much, much clearer now. Waste vehicles now are being routinely contracted for that in Cambridgeshire and elsewhere. It is coming, and it's becoming much, much more quickly. We don't have to wait for the government to outlaw diesel and petrol cars. We just need to get on with it and take action, because it's a no-brainer. The costs are coming down all the time. Industry is basically predicting that price parity for new cars within a year or two now for electric versus diesel and petrol, and the running costs are immeasurably lower. And that's a point that really doesn't get enough airtime. I totally take Drader's point that most of the people we're talking about here are people of low income who won't be able to afford new vehicles. We need to look at leasing options. Leasing costs are becoming very close to parity now. I was talking to somebody. Oh no, it's Mr. Badger. Mr. Badger has an electric car which he leases at a very reasonable rate. So you know this is happening much quicker than I think most people realise. And if you want a good source for information on hydrogen, there are plenty of others apart from H2. Chris Goodall's blog is brilliant on climate reduction. I'll put a link round.
Nigel, that's really helpful. Thank you. I knew that we would have many experts on this panel to discuss the full panoply of where sustainability takes us. Julie, please, I think you're going to have the last word before me.
I was just going to say that we have already established an HCC fleet subgroup who are specifically looking at all the potential options in terms of our fleet, and it is very much around the options, so looking at hydrogen and electric and the infrastructure that will be needed for either of those options.
Great, that's superb. Thank you. I'm intrigued that Chris is leasing his car out, but I'll leave that for another time. I think probably the way that we capture what appears to be a really cross-party support for sustainability measures is the fact that we've already agreed that every policy report that comes to panel will incorporate sustainability, climate change consideration. I look forward to seeing that attached to reports. I don't want it to dominate reports, but I do want to see it as a serious consideration. And then I think that helps address the points that members have made this morning. And I guess, you know, this is a very good example of, on these tight timescales, members need to hold administration to account. The feet have to be held to the fire so that we do crack on with some of this, and specifically those two really big priorities, which are transport and joint working. Thank you so much. That was an excellent debate, and thank you, officers, for contributing to that. Helpfully, Hugh read out the very long recommendations. I'm not going to read it out again, but I would ask you to agree or otherwise that this report be taken through to, I'm assuming it goes through to panel. It must go through to, if when it goes through to panel, I will make sure that I incorporate your views into my thoughts at that time. Thank you. There we are. So Nigel agrees, but we need greater urgency and ambition. So 9 years isn't good enough for Nigel, but there we go. Okay. That's helpful. And Nigel has circulated the link, as he said he would do on the. That's great. I think, colleagues, that is agreed, and we can move that agenda forward. Thank you, officers, again. We'll move on to agenda item 9, which is the review by Hertfordshire Adult Safeguarding Board into the early part of the pandemic, and its recommendation to us as a department, that this being an independent short review that was commissioned. Tom, you will be presenting this morning. This has already been to No, I get myself tangled here. This hasn't already been to scrutiny, but it is coming here. It's already been to the Adult Safeguarding Board. Thank you, Tom. And Chris, did you want to come in first?
Yeah, I was going to introduce it, if that's okay, Richard.
No worries, Chris. Thank you.
So just a bit of context, we'll hear from Liz Hanlon, chair of the Hertfordshire Safeguarding Adults Board, first around briefly around what she found. Tom's going to present on our response to those really helpful recommendations.
Oh, I understand. That's really helpful. Thank you.
And just in terms of the context, we are planning with colleagues in scrutiny in either January or February on adult care's response to COVID to date. Now, clearly that's a very quick and dynamic situation, but we think January, February is probably a good time to do that. That will include more detail on our response to the outbreaks in care homes and some of the emerging science behind the genesis of those outbreaks. We will be pulling together data from Hertfordshire to try and outline that and understand that even better than we are now. Clearly, our current priority is the response to the issue as it stands in front of us at the moment, but we will be working to a position in January and February where we'll have more data to share around the care home outbreak, both the first outbreak, but also how we're managing the second wave. That will be, say, scrutiny or January or February, date to be confirmed. But that's all I have to say. I'm just going to pass over to Liz now and then to Tom.
Liz, thank you. And members, you'll be aware, Liz Hanlon is the independent chair of the Adults Hertfordshire Safeguarding Board. Thank you. Are you there, Liz?
Yeah, good afternoon, everybody. Thank you for inviting me. I just wanted to talk through, I know everyone's had the report, so just to give you a brief background, really, that the purpose of the report was to identify learnings that had taken place through the care homes throughout the first wave of the pandemic, and to look at how those care homes themselves could identify any good practices, any improving practices that had taken place, and also to give the care home staff a voice in relation to the responses from agencies in relation to their involvement with the homes, and to look at how the professionals and agencies could continue to support the care homes in the future for another pandemic. So the response rate from the care homes was quite good. We had a 44% response rate. Questions went out to the care homes, and the questions were, as I said, were in relation to the practices within their care homes, and it was not to look at national decision making, because we identified that that was not the board's responsibility to look at that. There was a lot of feedback that we came back, and actually there was a lot of positive feedback, and I went back and held conversations, and I spoke to somebody from a large care home that covered not just Hertfordshire, and actually the response that I got back from them was that the response from Hertfordshire was over and above the responses they'd received from other counties. So they were very highly praising Hertfordshire, not just adult care services, but also other agencies. So in relation to the partnership working, so the majority of the care homes reported good support from GPs and other health professionals, CCGs, and from Herts County Council. There was also examples where the support was lacking, and individual examples were given, and that's been incorporated within the main report. That included communication issues from certain GP practices, professional differences around treatment and care given to residents within the care homes, lack of testing prior to discharge, difficulties in accessing professional support, and inadequate information sharing was also highlighted. While support from different bodies was generally valued, the repetition of collected information was highlighted, and that went through to one of the recommendations. The recommendations that came out, there were 6 in total. Partner agencies to review contract mechanisms for communications with care homes to mitigate against repetition. And what they said to us was, tell us once, that the central mechanism for obtaining data from the care homes came quite repetitive, and they were receiving throughout the pandemic maybe 2-3 calls a day from different professionals asking for the same or varied information. So they said that was a great drain on them. So that's one of the recommendations. Care home managers to prioritise work with primary health care providers, for example, GPs and district nurses, to ensure staff within the homes are not undertaking medical tasks during the second wave of COVID-19. And also for reliable access to professional support so that the care home staff felt confident in their ability to undertake these tasks. And that was to do with obviously during lockdown, because there was professionals unable to attend the care homes. The care home staff themselves were requested to carry out minor medical procedures, oxygen levels, insulin. So they said that they did receive a lot of care and support from the GPs and from the CCGs in relation to doing that, but they were concerned that that support would not continue through a second wave of pandemic. So they've requested that that continues. Any care home staff members who work in more than one care home setting should have an individual risk assessment for each place of work. And that was at the beginning, mainly at the assessment where staff were moving from care home to care home, mainly in the small care homes, and there was concerns about the pandemic being moved from one care home to another. And I know a lot of work has taken place in relation to that, and a lot of care home implemented additional support, as in picking up their workers themselves, not relying on them getting taxis or public transport. Infection control and refresher sessions to make sure that the awareness and standards are maintained, and that was the care home managers who ensure that all staff have regular refresher training sessions in relation to the control and promote its awareness in practice, and that was mainly to PPE training, sanitisation and care and support in relation to the infection control that took place within the care homes. Care provider management should ensure that all staff working within their organisations have access to support mechanisms to enable staff's well-being and continued resilience. A lot of care homes stated that, especially the major care homes, the larger the care homes, that they'd set up support lines, one-to-ones for their staff, and they highlighted not really to underestimate the impact on the pandemic and the impact that it had on their staff and their workers. And within the report, it's been highlighted just exceptionally how hard the care home staff worked in relation to supporting their residents and the things that they put in place for the support of their residents. And that was identified that through the second wave, if and when that was going to come, that the continued support would need to be put in place for that. And that care home managers working together with agencies should ensure that they have adequate facilities available for people from release from hospital, either having not been tested or who are COVID-19 positive. And this included end-of-life residents who were to be returned to the care homes. And I know there's been debate taking place around that already today. And I know that adult care services have put in a lot of work in relation to that. The recommendations, as I said, I haven't gone through the whole report because I know everybody's had it and has had chance to read it. The report itself and the recommendations have been presented to the Hertfordshire Safeguarding Adults Board, and they have been agreed. And the report itself has been published on the HSAB website. I'm open to any questions, but I'm going to pass through to Tom first to look at the response from Adult Social Care.
Okay, thank you, Liz. Grateful.
Okay, so just wanted to thank Liz and her team for the review. It's incredibly useful and feeds into a lot of the work that we've done in terms of trying to review how we've acted together with health and social care partners during wave one, to prep us and to give us some reassurance, hopefully, about our preparedness for the second wave, which has already started. So if I can just very quickly run through the recommendations. The first one, in terms of tell us once, Absolutely accept that. Care homes have been bombarded with information either directly sent to them or contacts from a whole range of statutory organisations. We've tried as best as we possibly can to streamline that. We've used Hertfordshire Care Providers Association, who are very well placed to engage and act across all care sectors, not just care homes, but all care providers. So we set up a provider hub early in March, and that was to try and distill all the various speeches that had been made by central government, the letters that were coming out, the guidance and the policy, try to distill it all in one place to be more helpful and pragmatic with the care homes about what they needed to do and when. A lot of the questions were around how they would access PPE and funding and staffing implications. And so I think we've been as helpful as we can. Notwithstanding that, it's incredibly difficult for us to stop other agencies, for example, the CQC, coming up with their own plans and information requests. But where possible, we've tried to distill that through the provider hub. We also set up a care home outbreak cell for those homes that either had notified of an outbreak or needed training and support to prevent an outbreak or mitigate one. So that we've set that up. That started in early April. It continues to run. It meets 3 times a week. We've got agencies from all health and care providers in there, and that seems to be working really well. And I think the care homes are very pleased about the support they get in there. One thing we did later on during phase 1, and we've got them much closer to us as we embark upon the wave 2, was engaging with environmental health officers from the districts. A huge wealth of local knowledge. They know the contacts, got the skills and expertise to support those homes, keep those businesses operational and safe. We have to work very closely with them, obviously, because we've got very much the expertise in terms of adult social care and care, but we are working much more closely with them alongside public health. So completely accept that recommendation, and we've got we've done a great deal, and we continue to keep that as a key focus. The second recommendation regarding access to professional support. I think, again, I completely understand why many care providers felt some degree of anxiety because GPs and a lot of health professionals and social care professionals who were regularly going in decided they would do everything where possible virtually. That left a lot of care home staff feeling that tasks they were being asked to do that they hitherto would have relied on other professionals to do would fall to them. Some anxiety around that. However, we've offered an awful lot of training, and a lot of care staff have fed back to us. They're very pleased about the growing breadth of their competencies, but it needs oversight, it needs continual training and support, and we're trying to strike that right balance between what they can do themselves with support and additional kits such as pulse oximeters and thermometers. They've been given iPads so they can support the virtual ward rounds. Where that's working well, that's great. If not, then GPs and care professionals can still go into those care homes with the agreement of the care home management. Third one around risk assessment of care home staff. Just want to make it absolutely clear that Public Health Hertfordshire and Adult Social Care have been clear with care homes from the outset that staff should not be operating between sites. Liz mentioned a big ask on smaller care homes, but often I think the more likelihood would be bigger care home organisations in Hertfordshire would have several homes. We're moving staff around as and when there were pressures, but we've been absolutely clear on infection prevention control requirements and making sure staff only operate in COVID hot sites or COVID cold sites within those care homes. That's been really important. In terms of infection prevention control, as I said, I think we've got a very positive story to tell in terms of the breadth and the consistency of training. We've brought in specialists from the CCG, from the acute hospitals, Public Health Hertfordshire, to try and support care homes with that. It needs ongoing support and refresher training, so absolutely accept that. It's interesting to see that a number of the outbreaks often have been from care homes that weren't affected during wave 1. That might have something to do with how diligent they had necessarily had to be in terms of their infection prevention control. So we're doing a lot more preventative work with those homes who weren't aware, we weren't known to us during wave 1. but an awful lot of continuing work going on there. The fifth recommendation around practical and emotional support. This is incredibly critical and important. I think we're all aware of the trauma and the impact that the deaths and the concerns and the anxiety has had on staff and the residents and their families. And it might be that we don't know what the full impacts of the pressure people have felt won't be fully understood for some time to come. But as a department, we did, working with Hertfordshire HPFT, Hertfordshire Partnership Foundation Trust, we worked with them to extend out their employee assistance programme to all care staff. The take-up was pretty poor, I must admit, even though it was publicised widely, but that might be because a lot of the organisations themselves had their own schemes, as Liz alluded to. But it's something that we absolutely are mindful of, and we want to make sure that we're doing all we can. The final recommendation was around the identification of separate areas for residents when they're released from hospital, having not been tested or having a positive test. Again, just to reassure you, from the 15th of April, no one was discharged from hospital into a care home in Hertfordshire without a known result. Hertfordshire went further than the national guidance, because the national guidance did say there could be some situations where the result would follow. We took a view, supported by all our health partners across Hertfordshire, that we would not go with that. We wanted a known result before any discharge, so that if they were negative, they could go to a care home and be isolated for 2 weeks as an additional precaution. If they were positive, and depending on their level of acuity, they would either go to a community hospital or one of the care homes that were set up to support COVID positive. And so that's Fairways and Nevitz. And for a period of time, supported by the community health provider, we did have 2 homes in Stevenage that were prepared to, in an isolated unit, take some COVID positive people. Numbers were incredibly small, thankfully, because of demand. But there is there should be no concerns about people going without a result known. So we know also that there was a letter of the 13th of October, which is outside the remit of this report, but the government are now asking us to designate sites, both for nursing and residential requirements for COVID positive people being discharged. So that's something that we've got set up. We've got cover in East and North Herts. We're still working with partners to provide sufficient capacity in Herts Valleys, but we're confident that those conversations will deliver the necessary supply. I just wanted to, if I can, just before I finish, is just highlight the contribution of hospices in terms of accepting people from hospital for end of life care. They work with us incredibly well in a very kind of caring and professional manner, and it's likely that we will need their services again, sadly, as we go through the second phase. Happy to take questions from there. You're on mute, Richard.
Thank you, Tom. Thank you, Tom, for your letting us know how we as an organisation have responded and continuing to support the care provider market. Liz, for presenting your report, and Chris introducing. Could I invite Ron and then Nigel to speak? Ron.
Thank you, Richard. And first of all, can I say thank you to Liz for a comprehensive report on most aspects, but unfortunately missed out the one I was particularly interested in, which was mentioned in the in Appendix 2 on the 3rd line, which actually referred to the terms of reference and asked for reasons for the spikes in so many words. But I want to address what Tom has just said, because he mentioned the 15th of October. 15th of April. The key period of which concerns us most is the period 19th of March to the 15th of April, when on 19th of March, the NHS released discharge guidance that had to be immediately implemented, and subsequently at the Health and Wellbeing Board, Nicholas Small, the chair of CCG, Herts Valley, actually admitted that a considerable number of those discharged patients had not been tested. So the issue is not from the 15th of April. So I'm perfectly happy to accept Tom's statement at that point. But the key period that's missing is the 4 or 5 weeks before that, when at the government's insistence, because of their panic at the potential crash of the NHS, they insisted that patients be discharged into, and some went into care homes. Now, that's the issue we've been pursuing all this time. It's unfortunate that this has been picked up, has not been picked up by this review, but I do welcome the review as far as it goes. But I also welcome what was said earlier by Chris, I believe, when he said that this whole area is going to be looked at next February, March by a topic group, a scrutiny group. So I'll leave it there.
Thank you, Ron. You'll be aware, as will others, that we haven't gone to scrutiny in terms of the national decision making. That is for government to scrutinise its own policy making, and that has been announced by Boris Johnson earlier in the summer. Nigel, Quentin.
I'm sorry, Richard, caught me on the hop there.
No worries.
Yes, I was a bit intrigued. I mean, Chris has said this is coming to scrutiny, or probably coming to scrutiny in January, February. I mean, as Vice Chair of Scrutiny, I haven't been involved in any of those discussions yet on timing. It is in the programme that this will be looked at in the light of Liz's report, but it's not firmly on the scrutiny agenda yet, to my knowledge. I will talk to David and Fiona to get clarification on that. Very much welcome it. I would like, though, to reiterate Ron's point. And whilst it's going to be very, very difficult to look at the national, advice and so forth at a local level, I do still believe, as we've argued time and time again, that the way we've had to deal with that national guidance does demand scrutiny. I've attended quite a few scrutiny webinars on this over the summer, looking at whether or not it's within scrutiny's remit really to try to tackle this. It's a very difficult thing, and the national discussion with CFPS, for example, basically concluded no, it's going to be very difficult for scrutiny to do this. But I do think there are lessons that we probably can learn from that, and it's not just about criticising what the government did and where it put its priorities. It's also about just assessing. I know that there are still studies going on, and Chris has told us that, we're still trying to assess the data as to where the infection most likely came from. Was it from asymptomatic workforce? Probably a very large proportion. Was it contributed to by the discharge of people that were not known whether they were positive or negative in that critical period? And it really must stress this. I mean, the problem in Hertfordshire, thanks to the very prompt action that was taken when we saw that the rates were going up so dramatically and sadly, did bring the thing under control very quickly. I mean, it is very noticeable, and hats off to everybody involved in adult care and public health on this. But it was really, I think our peak was 8th of April. So by the 15th of April, we had already acted. That's why it's so critical that we do look at that early period. The lessons may be very obvious, they may not be, but I do think that's something we need to focus in on a little bit more. And we also, I think, need to be looking at where the lessons could have been learned prior to this all kicking off. I know Ron has raised several times in the past the issue of the Cygnus report or non-report from the exercise in 2016-2017 that the government ran and then basically put on a shelf whilst we got on with Brexit. And nothing else happened. We don't yet know whether was the county aware of the recommendations, were there things that we could have been doing in better preparation for a situation as we've now had to go through. So those are the things that we would still like to see investigated, just to be clear. But very much welcome what Liz has put together. I think it's a fantastic report. Can't agree more with the recommendations, and I think what Tom has said in response is absolutely spot on. So leave it there. Thank you.
Thank you, Nigel. That's really appreciated. Chris, you wanted to come in.
Yeah, clearly the early conversations around the scrutiny, Nigel, the scope will be broadly in line with what you've talked about, I suspect, which is around we'll have to scrutinise our response to the guidance that was in front of us and how we responded to that guidance. And there's a number of things that we did as a local authority in partnership with the NHS organisations to try and minimise some of the what we now know were challenges that care homes were facing at the time. We may never know how infections got into particular care homes. There may just not be an answer out there to what that looks like. What we do know, is that where outbreaks are continuing now, that's not because of hospital discharges, because of the changes to the policy now, and is continuing, we think, through asymptomatic transmission, which is the most difficult thing to manage with this. So the focus, I imagine, of the scrutiny will be on our interface with that guidance and how we interpreted that locally and what arrangements we put in place to make that work as best as we could within that. And as Richard says, the wider issues around the guidance in and of itself will need to take place as part of a understandably national review when that comes along.
Yeah. Can I just come in here while Nigel and Chris stay on screen? That's fine. The key, Nigel, about how we responded and did we respond early enough? I think the letter that was thought through, that went from Ian McBeath to care providers. Perhaps Chris could confirm the date. I referred to at the full council debate was all about ensuring that we were doing everything we possibly could to flag up the issues that were coming down the track, albeit that they were arriving at people's doors at the time. I think it was the 13th of March when Ian sent that letter, and I reviewed it, and it you could send it again today and it would still be apposite. So I think that is the background to all of this. And then the letter that Owen Mapley wrote to government saying what has Hertfordshire done, and sent it off to, I think it was Helen Whately, was also fulsome in its understanding of how to respond to this pandemic. Your point about could we have been better armed by government, I don't think I need to answer that, but I think the answer is probably yes. It was a difficult place to be, but those early preparations, and particularly as Tom alluded to, helped us to get that, to help care homes through HCPA as well, to try and get the pandemic under control. I would say that the peak actually was probably even earlier than it was more like the 6th, 7th, 8th. That's when it was peaking. And it was a very, very difficult time right across Hertfordshire. I think in hindsight, we now know that we were not above average in terms of what happened in our care homes, but at the time it seemed particularly awful, and it was particularly traumatic for care staff where they had this often infection rampant in our care homes, which we've not seen this time round. Anyway, but that's. I feel I've been addressing you directly, Nigel. I hope you don't mind.
Not at all. Not at all. I mean, I generally agree with everything you said, Richard. I think the only thing I might take slight issue with, yes, we were above the average in those early days, and I think it's important that we recognise that. And yes, we got on top of it, and as a result of getting on top of it, we then found ourselves in the average, or around about the median, which is fine. But I don't think we should use that to sort of downplay the confusion and panic that we had at the beginning there. And having talked to people who were right in the front line at the time, I just I can remember myself. I remember, I don't want to claim any clairvoyance here, and I'm sure others in adult care were far ahead of me, but I remember seeing those first numbers appearing on the care home deaths and thinking, well, hang on, those aren't being counted in the official statistics. If we total those up and say that, well, what we're seeing here in Wellhat is typical across the county, actually that's as many deaths as we've seen in the public statistics. And crikey, we have got a massive problem here.
Yeah. Yeah.
But I mean, look, the basic point is, if Ian and Chris and Jim were running the country on this, we'd all be in a much better place.
There we are. There's I don't know why Chris is so limiting of his ambition. Actually, it's surprising.
I'm sure it's not.
Yeah. I think thank you, Nigel. Tom, you wanted to come back in.
Yeah, if I can, just very quickly, and I take on completely the points you've raised, Nigel, in terms of, whilst I wouldn't say less of panic, there was a lot of cliff-face learning that we were having to do. There wasn't a script that we were allowed to follow. I just would like just to point out, in early April, Jim McManus and I, Jim invited me to a meeting of his colleagues across the region from Public Health, where it was very clear that whilst we were very much learning as we went along, nobody else in the region had a care home plan. None of them had set up the cells or had the organisation that we felt was an absolute essential. And most of what we'd already done was then shared across the region. Doesn't necessarily mean to say that we've got it right. And I think the scrutiny will help to point out what we did do well, what we absolutely should have done differently. And I genuinely welcome that opportunity to have that debate at scrutiny. But I would like to give some kind of context that whilst we've got an awful lot of things that we'd probably want to do differently, I think the position that we are in now is largely based on the strength of the partnerships across health and social care in Hertfordshire. And I do think we are in the way that we responded collectively, and that's not Hertfordshire County Council, that is health and social care partners, made a massive difference to mitigating and getting hold of the virus as best we could.
There we are. Thank you, Tom. I'd just like to bring in with Nigel Bell. Did you want to come in?
Yeah, thank you, Richard. I just wanted to, other people have made the comment, right points, especially Nigel Quinton, obviously, and many of his points. But I just wanted to pay tribute to, this report that Liz has produced is very good. Obviously, pay tribute again to, as everyone has said, to what Tom has done and other officers. And these recommendations, the 10.1, obviously the recommendation 6 and 10.1, 10.2, 10.3 are fully support. Our argument, and it's not on here, and why we put the motion down, was really about what the government was saying. We weren't certainly, and I certainly wasn't arguing about what officers and what the policy here was. And clearly, looking at the looking back now at how Hertfordshire has responded, we do have to actually pay tribute as to how well Hertfordshire officers and adult care have responded so well. So yes, we welcome, and I certainly welcome the extra scrutiny that's going to be coming in the new year, and that's very important. But I just wanted to put on record really my support for Tom, Liz, and everything else, and how well you all reacted from that beginning of April. We can have the argument quite rightly about dates and what the real reasons were for that period, and that's something we'll need to look at in the future. But I just need to put that on record. Thank you.
Thank you, Nigel. That's helpful. I'll hang on, Chris. I'm going to bring in Dreda first, then Chris Badger.
Yeah, thank you. I'd just like to echo what other members have said in terms of my support for all the good work that's been done by our team. And thank you for this report. I think it's really interesting, and I take on board what Richard says, that there will be a time when central government will be scrutinising its response to the pandemic. But I would also welcome the opportunity for HCC to look into how our operation has functioned, particularly I think in terms of what Chris Badger said in our interface with the NHS. The government department is called Health and Adult Social Care. So, sometimes I don't always think that works as consistently well as it should do. And I mean, it would be interesting to explore the pressures that we were under from our local health services in terms of accepting people perhaps into our care home settings where there may not have been tests done in the early days. And I'd also like to explore, I mean, there's lots of things in this report. I think there's plenty of meat there for scrutiny. But one thing that I particularly was interested in is the support that we would be giving or presently giving to care home providers in terms of their emotional well-being and supporting that. Because, I mean, these people have been through an extremely tough time already. And they're likely to be going through the same again. And I'd like to think that there is that physical and emotional support there for our workers and for the workers in residential care and home care settings.
Drew, to just stay there a second. Quite early on, I think it was in April that within HCPA set up an independent support for both mental and physical health, and to help anybody that was felt traumatized by what they had seen within their care homes. And that was set up, and again, utilising what we'd already got in place, which is HCPA, and Tom commented on that earlier. So thank you for that, and for our own staff as well. There are ongoing, since April, there are ongoing conversations about what support do we need for our frontline staff, and that includes, and a really big consideration for our BAME community, who are, one of their challenges has been being right in the front line, heavy viral loads early on, and really making sure that we've got their considerations at our heart. Can I do one other point before Chris comes in? Nigel was saying about how horrified he was at the infection and deaths that were coming in, and I just wanted to say I saw the same thing myself. And all I would say is I just was really important that information went out to members and to the wider community, including to our MPs, and that was put out there very early on. There is nothing to hide here. It is for us to debate whether we should or shouldn't have done something differently. It is not about hiding data, and it never will be. Just a small point. Chris, you wanted to come in?
Well, I imagine to round up, but to just say, that's nice to hear about the gratitude for the work that officers did at the County Council. The main thanks, I think, goes to and continue to go to those working across social care in this in the response, both the response in March, April, May, all the way through the summer. We've not stepped down as a sector in terms of response to COVID, and clearly will be a very challenging winter for the workforce in social care. And I wanted to be clear that the report on provider support and so forth is aimed at doing everything we can to support those people working on the front line in social care, do what they're doing to support Hertfordshire residents, and it's them that deserve the greatest praise and thanks for the work they're doing on a day-to-day basis, which is great at the best of times, but in the particular in the midst of a global pandemic, the work of our frontline social care workforce across all agencies, organisation, providers is the one thing that we should really hold on to, I think.
Thank you for saying that, Chris. I think you probably speak, you speak cross-party. We through Steve John Medhurst's motion, we gave that thanks and support to the care sector. So absolutely. Colleagues, I think it's just simply beholden on me now. There are no more speakers, and I think I've got everybody has commented. Yeah, that's fine. Thank you, Dave Hewitt. I agree with other group members. This is a good report, which includes excellent information reporting. Thank you, Dave Hewitt, for that. Liz, my thanks for you picking this up at relatively short notice, taking the scope and working with it to give us this opportunity before we're even in the thickest of the second peak. The officers have had the opportunity to make sure they inculcate the recommendations into practice. I think it builds on what was good practice to start with. And if we hadn't had that proactive approach, we would have really been struggling with the pandemic. We'd always been on the back foot. We weren't, particularly with the care providers, particularly through HCPA, but across all of that work through the Shielding Sustain programme, through the voluntary sector work, and working with health colleagues. Some of it challenging, some of it really challenging, some of it still challenging. Only recently, we know that somebody from one of the senior managers and discharge team standing up to the health service to say, no, you will not discharge somebody from hospital if they've not been tested. That is still happening, but it's really, really good. I think, as Tom said, or somebody said, really good partnership working that is the heart of how we are coping in Hertfordshire. So Liz, thank you so much for your report, and colleagues for supporting Liz this morning. For officers Tom and Chris supporting Liz this morning. It's really helpful. I think we are asked to note the report, and particularly your comments are invaluable, to be honest. And I hope we have a fulsome minute on the report, so that there's a really good record. I wouldn't normally say that about minutes, but I think in this case it's true. I'd like it. And then the scrutiny can build on this report after Christmas. Thank you so much. Would you like to express your view on this report? Thank you. Apologise for the noise. The wind's really picked up, and it's starting to howl at the moment. Colleagues, thank you so much. I think that report is agreed, and your wholesome thanks for its quality and presentation is appreciated. Thank you. That's good. Colleagues, with your indulgence, I'm going to press on with our final report today, which is the winter plan. It's 1:45. I think we should just move through to our last item, unless I'm just going to hold a pause for a moment. Does anybody disagree with that? No, there we are. We'll crack on. Colleagues, the winter plan is possibly one of the most comprehensive documents that I think I've seen in a long time. Helen Minerve has driven this with her colleagues, and this is our response, not just to COVID, but how we're going to work with the health service during the winter. And it's been hinted at by Chris Badgerone a few moments ago that how we work together is going to determine how we're going to get through this winter. So Helen, if you'd like to introduce your report, I'd be grateful. Thank you.
Thank you, Chairman. So I suppose in this final item to look forward now to the next 6 months, and I'm going to present the winter plan for COVID for adult social care in Hertfordshire and ask panel to support our work to implement this plan over the coming months. So very briefly, the government issued its national winter plan for adult social care at the end of September, and this is the first time there's been a national winter plan for adult social care. And via this plan, the government wants to ensure that all people who need support can get good, timely and safe care through the autumn and winter, that staff and people and carers are safe from infection, and that we're all doing what we can to support people to remain connected with loved ones and friends and communities over this time. In Hertfordshire, we've always had a winter business continuity plan, but this is the first plan of this particular nature. And I guess that's a sign really of the challenges that we are addressing as we go into this period. As Richard pointed out, it's only something we can do by working together. And so we've discussed these plans with the co-production board, with voluntary and community sector representatives, with the NHS, our partners in the CCGs and HPFT in particular. And the plan outlined here builds on the work that we've already done, that we've heard so much about this morning, that the partners in the wider health and social care system have supported us with so far. It sets out our ambition for the forthcoming 6 months, and we'll use it to shape our response and to monitor the impact of this work carefully. And finally, Chairman, I would finish by saying it's clearly a very fluid situation, and even in the time since this report went to press on Friday, things have changed again. And so we'll need to be responding very flexibly and agile as we go forward. Thank you, Chairman.
Helen, that's succinct and really sums up the report. I'll make some comments in a moment, but Ron, you'd like to come in?
Yeah. First of all, can I say thank you, Helen? I think it's an excellent report. It's really comprehensive, and I think sets us up well for entering into whatever we're going to face after Thursday. I've only got 3 small areas, Richard. I've got other areas I shall write to Chris and Helen separately to save the committee's time. But no, thank you. Certainly on at 515, theme 1 at 550. Paragraph 517 is the discussion about personal assistance, and I'd be grateful if we could have confirmation that we will look at whether or not there is any sharing of personal assistance, or whether or not they have multiple clients, because I do think that's an additional risk to already vulnerable people. So a bit like sort of care home assistants, agency workers working in more than one care home. I think with personal assistance, I think that needs to be looked at. Secondly, on 6.8, primary care networks, while they, a lot of them do excellent work, I do know that there's been varied rollout of the flu vaccine from comments with colleagues, and I would just think that just needs to be checked, and to ensure that the primary care networks are actually, all the networks are fulfilling what we want in this.
Can I second that, Ron? I think under 5.9 we could just get a little explanation of how primary care is dealing with the flu jabbing requirements. Thank you.
That's right. Yeah, I'm referring. There's a paragraph 6.8 in theme 2 which refers to primary care networks. Distinct, but I think the performance is a little bit varied, and I think that needs to be picked up. And then finally, 9.6 in theme 5, I'm going back to my worry about do we at the moment have any idea of the under occupancy of care homes? Remember earlier, we actually have saved £10 million this year because of that care home sort of vacancies, and I just wonder, has anybody looking closely at whether or not that affects the sustainability of the care home providers going forward over the next sort of 6 months to a year?
I thought we'd covered care home sustainability in our previous paper, how we were going to support care home providers. But I'll let Helen pick that up, Ron. No worries.
As I say, I just worry that if they're running an under occupancy rate of, even if it's only 5 or 10 empty beds, that could be their profit margin, and with the extra costs could push them towards dangers and then reliance on us. So just those 3 things. I'll cover everything else in a separate memo.
Thank you, Ron.
So I guess just thank you, Chairman. Just to go over that point. So the underspend, really, at the moment, we're not forecasting that will actually materialise, because we've set that money aside to support providers who may be having precisely those difficulties that you flag up, Ron, around sustainability. So we can have conversations with those providers over the next 6 months. We've got a clear process set out, which Cabinet agreed back in September, to organise that through. So hopefully that will be a useful way of supporting the market at this time. Around GPs, primary care networks, I note your points. I'll take them into conversations I'm having with health partners over the next while. There is a new contract on GPs that's called the Enhanced Health in Care Homes Framework. And the CCGs will be monitoring those GPs as they deliver on those commitments in that framework. I know that the experience of the care home cells has been, by and large, that the GPs have stood up and they've been working very well with us and our emergency work. But I think it's something we do need to monitor and keep on our radar. And then the final point about PAs, yes, so we're very keen to make sure that PAs are getting the required PPE that they need to deliver their work safely. We are putting in place a process of delivering that to them. So that's a sort of change and an improvement that we've put in for this winter plan period. I'm not entirely sure about the details and the monitoring we may be doing on PAs moving between different people. So that's something I can come back with some reflections on, Chairman, if that's okay.
Yeah, that's lovely. Chris, did you want to pick up that?
Yeah, there will be PAs that work for more than one service user because of the nature of their work, in the same way that domiciliary care workers work across different service users. Obviously, where possible, we're trying to minimise that, but that's why appropriate use of PPE and how we schedule that is going to be important. And I think the approach we've taken, which is to get that centrally, source it centrally, and then get that distributed directly, is the best way of ensuring that people are protected in the right way.
Good. Could I ask Drida for your comments?
Yeah, thank you, Helen, for the report, and thank you also for the opportunity of a briefing prior to this coming to panel. I found that very useful, so I'm not going to take up too much time with a whole pile of questions that I've already raised, but I would like to take on board the comments that Ron has made, particularly in terms of GP services. And I think it's worth noting that there has to be a sort of sensitivity around the service that GPs provide to residents in residential care, because many of them will be seeing somebody who is completely different to the GP that they may have been seeing for the last 50, 60 years. And you know, it'll be somebody completely different, and I think that has to be taken on board, and also that there's a consistency of the service that's delivered across the county. The one point I did raise with Helen, and I'm sure she's going to come back to me, not necessarily now, was in regards to the Gypsy and Traveller communities, which form part of our portfolio, your portfolio, and what the responsibilities of this panel. And I wondered if we had got any information on COVID statistics in relation to those communities.
Thank you, Drida. Helen?
Yes, I don't have any information on in terms of the stats, but what I have included following our conversation is just to highlight that we have given some funding to GATE, which is the Gypsy and Traveller Empowerment Organisation, and they've been doing a lot of liaison work around COVID-19. But I can certainly go back and ask the question about what data we've got in that regard.
There we are. That's helpful. Thank you, Drida. Nigel Quentin.
Yes, the comments have already been made on the flu vaccine issue, and I just wanted to highlight the Health Watch report, Health Watch Hertfordshire report that came out, I think, a week or so back. I'm sure Health Scrutiny will be picking this up, but I think it's the inconsistency across the primary care network that's a bit of an issue here, where some GP practices have been very, very good during the crisis, and others have not been quite as good in adapting to the new environment that we're all operating in. That was all.
Okay, thank you, Nigel. Does anybody want to just comment on flu uptake? I wonder, Tom, do you feel that you would want to make a comment there? I'm putting you on the spot.
I can talk. We've done some. We gather each information every week in terms of uptake in care homes. We've got data on care homes, so care home residents that have been vaccinated and care home staff, both directly employed and agency staff. But we're also working across all care provider sectors, including our own staff, to really ramp up the urgency with which they really should consider having a flu jab this year. It's never been more important, I think, than this year. We've got to balance that with, we know that the capacity and stocks in pharmacies and GP surgeries are such that they're having to prioritise, and at the moment they're only prioritising over the age of 65 and or people with underlying health conditions who present a higher risk. But all frontline health and care workers should be offered a flu jab. So Chris has written out to all of our frontline staff and we're working very closely with the CCGs and with colleagues in children's services to make sure that we give that that message loud and clear. And we know that Jim McManus has also made provision for every single county council employee to be able to claim back on expenses a flu jab should they be able to secure one. So I imagine it'll come in waves. We're expecting the additional stocks to be released this month and again probably in January. As people have already picked up, it's very difficult to distinguish between COVID symptoms and flu-like symptoms. But there was a comment in the chat, forgive me, I can't remember from which member, but I absolutely agree that flu is likely to take a dip because more people are going to get vaccinated. At the same time, the more people that get flu vaccinated will get a better understanding of those that have actually sadly contracted COVID. So there's a two-pronged attack needed there.
Understand. Tom, that's really helpful. Thank you. And Nigel, for your comments, that's appreciated. Fiona Hill, can I bring you in?
Thank you, Chairman. At the danger of repeating, and obviously I am in support of the comments that Nigel and Ron have made, but it's in no way a criticism of the service, because I think the GPs, pharmacies have all been working fantastically through all of this, but it is inconsistent, and I know there have been cancellations from pharmacies, particularly because they've actually run out of the vaccinations. So it's just really to raise awareness, and if there's anything that we can do to try and rectify that. I mean, I appreciate Tom is saying that hopefully there'll be more supplies this month, and clearly it's good that there's more people actually having the vaccination, because hopefully that'll alleviate problems.
There we are. Okay, Fiona, thank you. Tom, your hand is raised. Did you want to come back?
Just very quickly, one of the reasons why flu vaccinations are ordered a year in advance, and so GPs and pharmacies will be have ordered this year's stock based on prevalence last year, and obviously we didn't have the hindsight then of what the additional demand would be. That's why I know that additional stocks are rather hastily trying to be brought forward, but pharmacies and GPs can't be criticised for a lack of stocks. It's I'm not saying that Fiona was criticising them, but they're being completely overwhelmed.
I understand, and we've encouraged that overwhelming to some large extent by asking people through public health to get down to your GP. But I think, as we discussed at full council, it's something like nearly 80% of care home residents have had a flu jab, and 10 days ago, the only place you could get it in the open market was, I think, Asda. But I think that word having gone out, I suspect they're running out as well. Thank you so much. I mean, this report is really important, and I hope you don't mind a couple of things that I pulled from it, which was, and we have discussed this already today, and it's acknowledged, we will not discharge without a known test result. That's so important. That was 1.7. The social care, the ethical framework in our ways of working, incorporating that again, referring to the connected lives approach. So we're not going to do anything to you without you type of approach. The care home cell coordinating responses across all care settings, including the 18 to 64-year-olds, including those with learning disabilities, and easy read information for those with learning disabilities to engage them in their own hygiene and self-protection. We've covered the flu issue. The community learning disability nurses who are working with our LD to make sure they get their flu jabs. We've covered the hospital discharge in earlier comment. Operation Sustain, an awful lot of planning. Helen Duncan Turnbull in charge of that now. An awful lot of planning so that those who are want to really stay out of the public way can be supported at home, and making sure that there's opportunities for them to receive support. I think there is so much that is good practice in here, and I suspect it will evolve as the winter goes on, but it holds ourselves and health to account on how we're going to manage pandemic and flu and all the other winter pressures all at the same time. Helen and team, thank you so much for what you have done and presented for us today, but more importantly, the guidance that it will give to health and social care in how to meet the needs of the next several months. So panel, just checking. Yeah, that's fine. That's absolutely fine. Panel, could I ask you to, let me just see what the recommendation is for the winter plan, which panel is asked to note and comment upon our ACS winter plan and support the interim director of Adults Care Services' intention to implement the winter plan in coming months. Is that agreed? Thank you. Colleagues, I'm going to take that as unanimous support for that report. That's really helpful. Thank you. That brings us to the end of today's agenda. It's been long. It's been necessarily long. There's some really important content that has been before you today. I can't thank you enough for your indulgence of time and energy and input this morning. Really, really helpful. I think this is part of our setting the scene for as we start lockdown, but also as we approach the denouement of the second peak. And I really appreciate your efforts this morning in helping further this programme of work across adult social care and health. Really important. To officers, thank you for so much effort in making sure that we had our reports this morning. But also in that further engagement with wider health and care settings. Without your guys' energy, none of this would happen, and we are hugely grateful. Thank you very much. I'm going to wrap this up by just saying thank you again, especially we are all, as we have said, thinking of care staff at this time, families who are struggling to meet with their loved ones in care settings. You have our thoughts now and over the coming weeks. So without further ado, thank you very much, colleagues. And that's the end of our meeting.
Thank you, Richard.
Thanks, Rob.
Richard.